that were experienced in 4 counties in north central Kansas. About 400,000 acres were burned. There's an estimate that thousands of cattle had perished as well, and so we're hoping to have an update in regards to that later on this afternoon. Committee, you'll have in front of you the minutes from the October 8th and the November 5th meeting. If you will review those minutes, we'll have a vote on that after lunch. All right, I just had an update from Amy that we do not have the November 5th minutes. We're hoping to have those by tomorrow, so we'll vote on those hopefully tomorrow. But please review the October 8th meeting minutes, and then we'll do that when we return from lunch. We're going to go ahead and move on to the major first item on the agenda, and that is the state hospital moratorium presentation. So I would invite Secretary Howard with the KDAD's office to join the committee. Welcome to committee.
Thank you, Mr. Chairman. It's a pleasure to be with you today. I'm pleased to come before you today and give you an update as it relates to lifting the moratorium at Osawatomie State Hospital. I've had the opportunity the last 3 years to talk in front of committees several times about this issue and about the various steps and plans to get to, frankly, where we are today. So as I start my presentation, I wanted to set a bit of a context. When we think about behavioral health modernization and lifting the moratorium at Osawatomie, there's a number of facets connected to lifting the moratorium. There are facets that have to do with what's happening at the state hospital itself, and there are facets that have to do with what's happening in the community. And I would thank this legislature for your support for the development of regional alternatives and for some construction projects going on at Osawatomie State Hospital. But on slide 2, I've shared this slide I think really over the last couple of years in terms of priorities, in terms of increasing our state hospital capacity, also priorities in terms of developing regional beds, what we're now calling state institutional alternative beds, and I'll talk in more depth about that in just a moment, that allows Kansans to receive services closer to home, reducing the demand on state hospitals for both voluntary and involuntary admissions. And then 2 other facets that are really important as we think about the demand on state hospital services, mobile crisis response systems, and again, you've funded those services for adults. I'll give you an update on that as well. We've recently implemented those services for youth from the DCF side. And then the continued growth of our crisis stabilization centers in the community and our progress on developing the crisis intervention centers. So I'll give you updates on each of those things today. And I'll share the podium a little bit with my Deputy Secretary, Scott Bruner. I'll focus primarily on the community side, and he'll give you some updates specific to the state hospital itself. You know, this moratorium, as everyone on this committee knows, I think, at Osawatomie on voluntary admission started back in 2015. In June of 2015, we announced late last week that our plan is to lift the moratorium on January 3rd, so just a few short weeks from now. Our staff are busy communicating with a number of stakeholders and partners. There's a meeting with the mental health centers in the catchment area this afternoon. We will make formal notification to the Supreme Court and district courts by December 30th. And then we will start reviewing screening forms for hospital admissions for voluntary patients on January 3rd. One of the facets you'll hear a little bit more from Scott about as well is that we're also adding back into Osawatomie the ability to do social detox services on a very limited basis. This was a service that was available before the moratorium was imposed. We've had a lot of interest and input from law enforcement about the need for that. So we will be reserving 3 beds starting January 3rd, and we'll and are creating a notification process to law enforcement for how to access those beds. So when we think about lifting the moratorium, as I started out saying, it's really a mix of bed capacity at the state hospital and increase in community-based capacity. You know, the vision that I've certainly tried to present the last couple of years, I think the vision in the governor's budget and the budgets that have been supported by the legislature have been about how do we increase community capacity, allow folks to be served closer to home. So my team has been doing extensive work over the course of the last year to develop that community-based option. And I think last year, you've heard us talk about regional beds. Our terminology has switched a little bit to talk about state institution alternative. So you'll hear about SIA beds. And that's now become a new provider classification that we've worked with KDHE and the Medicaid program to implement. And so it really becomes a new provider type for both Medicaid and uninsured programs that allows private psychiatric and community hospitals to accept patients with mental illness who might otherwise have gone to a state hospital. They have to go through the same screening process and be approved for admission to a state psychiatric hospital, but then it allows some of those individuals then to be served in an SIA bed in the community. This can be voluntary or involuntary admissions. As you can see on slide 4, we currently have 8 hospitals that are approved to be SIAs. 5 of those in 6 locations have made it through their enrollments with Medicaid. 6 of those have contracted with our contracting partner, HealthSource Integrated Services, who manages our screens in this process and has managed our state hospital screening process for a number of years. And then 6 are already accepting admissions. We kind of started a bit of a soft launch for these community hospitals back in September. Six are already accepting admissions. We have 2 additional hospitals that are planning to submit applications in the coming weeks. If you look at the next page, you can see the location of where we have those state institution alternative beds right now. Cottonwood Springs and Olathe. We have some of the youth beds through KVC, Newton Medical Center, Prairie View, South Central Kansas Medical Center, Via Christi, that really should say Ascension Health at this point. And then we have a new health in Shawnee that would be coming on soon. We have 2 others that we expect applications for in the coming weeks in both Leavenworth and Fort Scott. There are 2 entities that are doing some construction work, need to go through some licensing, and we are expecting applications from them in the coming weeks as well. Just to give you a sense of utilization, since we started September 1st or August 30th, 122 adults and 291 children have been served in those SIA alternative beds. And based on an average length of stay of 14 days, that's about a utilization equivalent of about 17 beds. And when I testified in front of all of you last year, and you'll see this on an upcoming slide, I said really to be able to lift the moratorium, we really need to have 15 to 30 community beds. And so we're averaging about 17 now, continuing to grow. I'm going to ask you to skip page 6 for now because I'm going to allow Scott to speak about that in just a moment. And I'm going to focus your attention on the bottom of page 7, kind of a big chart. I want to talk a little bit about the role of the crisis services beds, crisis stabilization, and crisis intervention. And you can see the number of beds in December of 2019 and additional planned beds. And again, I'm focusing on the bottom of that chart right now. From the crisis stabilization side, these are the crisis centers that are funded through the lottery funding, through the lotto funds. And these primarily are focused on voluntary admissions. You can see that we continue to have some growth there. We have had some expansion, including the first awards that we made for children's beds for crisis stabilization services here in Topeka at Family Service and Guidance Center. Then I would also point out that you'll also see the next large iteration of that will open up will be in Lawrence, Douglas County, 32 beds this spring. The crisis center is in the construction phase right now. There also are additional crisis stabilization efforts happening through the Guidance Center in Leavenworth County, Horizons Community Mental Health Center in Reno County, and Crawford Community Mental Health Center in Crawford County. We anticipate making awards to those three entities this year as well as they get their plans into us. I'll come back and talk about the crisis intervention in just a minute on the next slides and give you an update on the status of regulations for those community-based crisis centers to take involuntary admissions. But again, I first wanted to give you an update again on those other important community pieces, the mobile crisis. Again, we're working towards implementation of mobile crisis. We were able to stand up mobile crisis for youth in July through some federal grant funding that DCF had received. And then you have funded in the budget, in this past year's budget for the current year, funding to stand up adult mobile crisis. We are on target for that. For folks served under CanCare, the mobile crisis will be built into the CCBHC rates and should be ready to go for adults when that program kicks off in May. And then we are issuing an RFP for the uninsured population as well. And again, this is obviously, in addition to just the importance of the ability to kind of alleviate crisis in the community, this is also very important in the context of implementation of 988. So again, these mobile crisis teams, there may be times that they can resolve the crisis in person. They can also facilitate entry to a local crisis stabilization unit or an emergency department if medical services are needed. And if those things do not resolve that and they believe a state hospital screen is needed, they can help to facilitate that screen for admission either to an SIA hospital or a state hospital. In terms of the crisis intervention and stabilization centers, I already referenced the crisis stabilization units that are currently operating and showed you a listing of those across the state, including mention of the new one that will open in the Lawrence Douglas County area this spring. But I think more important for the update today is the Crisis Intervention Center. So those regulations to develop those crisis intervention centers are drafted. They've been reviewed by the Department of Administration. They will now be going to the Budget Office and the Attorney General's office. So I would expect within the next 45 to 60 days, we'll be at the public hearing stage and we'll start that 60-day public hearing. What's so important about this is that when these regulations are final, then those crisis units in the community who choose to be crisis intervention centers and who meet these licensing standards will also be able to take involuntary patients and be able to divert some admissions of individuals in crisis to the state hospitals. I think as we talked last year, certainly RSI in Kansas City, also Topeka, the new center in Lawrence and Wichita, we think are all ready to step up as soon as we can get those regs finalized. And again, I have I think a much better, I feel much better standing up here before you today, letting you know that those regs are actually in the formal review process and will be to the public hearing stage very soon. So I wanted to focus on those community-based pieces and to let you know that, I mean, our work continues towards growing that capacity in the community. You know, as I said, we've been averaging the usage of about 17 beds through the SIA program right now. The crisis services continue to grow, and that really gives us the confidence that we're in a good place to lift the moratorium. What I'd like to do now, and I'll be here to answer questions as well, but I'd like Scott to put the context on in terms of the state hospital capacity and how we will manage census as we lift the moratorium. So if it's all right, Mr. Chairman, I'll pass this to Deputy Secretary Brunner, and I'm happy to answer questions now or when he finishes.
We'll just go ahead and have questions
Okay.
when he finishes, but
Great.
that's fine. Yeah,
Thank
go
you.
ahead.
Thank you.
Thank you, Mr. Chairman and members of the committee. My name is Scott Brunner. I'm the Deputy Secretary for Hospitals and Facilities for KDADS, and part of that is working with Osawatomie State Hospital in the moratorium lift process, but also with Larned, KNI, and Parsons State Hospital. I'm happy to talk to you today about kind of our progress on the campus itself to get ready for what we've announced to lift the moratorium at the beginning of the year. I'll point you to slide number 6. And I'll apologize to my boss for probably not putting the slides in the order. I thought I was going to do the whole presentation, so it was ready for me. But that, anyway, I'll direct you to slide 6, focusing on the campus itself. The Secretary did an excellent job out describing the community development process that we've been through in standing up SIAs, getting the crisis system built in Kansas, and that community focus is really diverting people from not needing the state hospital, but from being placed at the state hospital to get the services closer to home. But part of what you approved in the budget over the last couple of years is also some expansion of space on the campus, and that's focused around our Biddle building on the Osawatomie campus. In 2021, the approved budget we're operating under now has had $2 million to increase our licensed beds by 14 in the Adair building, which is our B2 unit. That construction process is underway, well underway. We had some delays related to the construction and materials through the summer, but we've got all that back on track for an occupation date of January the 15th. We had some doors that we needed. The patient rooms need doors to be secure, and the pipeline for that was a little tenuous, but we got confirmation that they would be delivered in December, and that helped us also be certain that we could hit that January date. I didn't see them, but I was on campus when they arrived last week on the 15th, and I know they're being installed over the course of the next couple of days. That does add 14 patient rooms that we'll be able to use. The primary purpose of that B2 unit is to create space so that we can move patients out of the Biddle building so we can start the construction and renovation there. So the approved budget also has $5.3 million from the State Institutions Building Fund to do that remodeling in the Biddle building. There's 2 wings, east and west. We currently use the east Biddle wing is occupied with patients. Those are the folks that will move sequentially kind of around the campus to free up the space, so then we can go in and kind of refresh that side and do a complete remodel of the west wing for patient rooms. And the objective of all that is to have that entire building be certified so that we can bill for Medicare and Medicaid services inside that building, in addition to our 2 units on the Adair acute unit as well. It's an important part of the funding scheme to have that certified and be able to bill for Medicaid services in that space. It's not required necessarily, but the design that we've got is intending to have it be certified so we don't run into a situation where that might be at risk sometime down the road. We've got a design, we've got construction documents, we're in good shape moving that forward. We did bring a consultant in to give us some advice about the certification process and just have her look at the design to see, does this meet all the things that you think CMS is going to look at? She had a couple of suggestions about configuration, and because that building also is where our admissions unit is, though there will be patients coming through there that won't be placed on the certified wing. So we need to keep the patient flow separate was the main objective. So we've got a couple of tweaks to do to the design there. They're fairly minor. We expect construction to start late in January of next year once we get the other space cleared out and patients moved around, and we expect to be able to occupy the Biddle building sometime early in 2023. We've had January as the scheduled date. Again, hopefully we don't have any construction delays when we get those other remodeling done, but it's well underway. We feel good about that space and the progress we've made so far. So that's kind of the space. Once we get that complete, then the bed count that we identified in our planning from last year would be where we expect it to be. It'd be 110 licensed beds. So that's the top row of the chart that's on that the Secretary referenced before. Be 110 licensed beds. So that is kind of flexibly, we can use those patient spaces, and 72 certified beds and licensed by CMS. And that's 14 more than we've got today in our total combined capacity. So along with that, I'd turn you next to slide 10, skipping over the other community ones that the Secretary already talked about. She already mentioned social detox. This was one of the service options that was available before the moratorium, and in our discussions with law enforcement, mental health centers, community partners, it's one of the elements that they wanted to make sure we had included as we were getting ready to lift the moratorium. The purpose of the social detox is for a person who's in law enforcement custody. They could come to and under the influence of some kind of a substance, and they may also have some mental health issue, to come to the campus, get stabilized, figure out what's going on with their with the substance issue, and then do an evaluation if they need ongoing care. They can be held for up to 24 hours with that law enforcement once they're delivered by law enforcement, and then once the detox period's complete or that 24 hours expires, we can evaluate them again to see if they need ongoing mental health needs based on the admissions criteria for any other patient. And we've got 3 beds reserved in the plan for that. So right now our census is 52 beds in the Adair unit before all of our construction is complete. So we're taking 3 beds out of that total count to be available for social detox. We feel comfortable with that number given historical utilization before the moratorium. We've talked to our colleagues at Larned of the kind of the social detox flow there as well. We think that's the right number, but time will tell a little bit, but we think that's the right number to have reserved available. And we've got staff at Osawatomie already who have the certifications or can get them to provide the addictions counseling that's needed. So we think that's a good addition to the service mix, part of what law enforcement needs to serve folks in the catchment area, and so we'll bring that up on January 3rd as well. We do have an enhancement in our budget request to the governor's office to build out that team, add some resources to that social detox team, somewhat anticipating utilization to go up, but also to keep us from having people directed both to the forensic or to the psychiatric treatment side and the addictions counseling side, even though it's a small number of beds. But you'll see that when you review the budget when you come back for the session. On slide 11, I started talking about recruitment on the bottom of that one, but wanted to put a little more context around it. So we feel good about where we are with space. We feel good about where we are with the SIA contribution to the bed mix around the state. Kind of the third element of that is as we add space and want to bring more patients in, we have to have the staff to treat them, provide the ongoing care. A lot of it's about kind of the day-to-day interactions between a mental health disability tech, that direct care worker, and patients. But it's also nurses and clinicians and psychiatrists and physical health physicians. All of that's important. So we've spent a lot of time over the last year recruiting staff. It's been our situation is no different than any other healthcare provider that you've probably heard from or in your communities. It's just really hard to find nurses, really hard to recruit. But a couple things have happened that we're optimistic about. Over the summer, due to, in large part, advocacy from our superintendents and working with the Division of Personnel Services and the Division of Budget, we were able to raise the starting wage and kind of incrementally move current employees' wages up that are in those mental health disability tech positions at Parsons, KNI, and Osawatomie, up to $16.16 an hour, and then made some other changes to keep compression from happening. That had a really big impact at Osawatomie, or at Parsons and KNI in recruiting, and it's helped a little bit at Osawatomie, but we still got some work to do there. But starting from that kind of higher place in the summer, the governor's announced, and the Spark Committee has approved, and as of last Friday, the State Finance Council approved some other increases for 24/7 facilities like our state hospitals. That'll impact nurses' pay, and then everybody else on the campus. And because the Osawatomie vacancy rate is high enough, I think for nurses, they get 3 of the 4 hourly bumps, and the other staff will get 2 of the 4 hourly bumps. Then the last part is what's really gotten us through the pandemic is working with contract staffing agencies for nurses, techs, social workers, kind of any position that we can get an agency to provide us, we'll work with. We've extended all of those contracts for another year. We've added some additional vendors to that mix, which does help supplement the staff that are on board. We'd really love to, and the long-term plan is to have more full-time staff and rely less on the contractors, but that's really saved us through the pandemic. So that's recruitment. We were also focused on retaining the folks that we've got at Osawatomie that have been through a lot over the last several years. The acting superintendent there and I have been on the campus. Dr. Dixon's there 3 days a week. I'm usually there 1 day a week and have been for the last several months to work on issues, kind of keep the staff motivated, and we, not culminated, but one of the steps that we did 2 weeks ago was have a week-long staff recognition event with food and events and drawings and raffles. Got a lot of support from the community to have giveaways that when we had people check in the morning to get their temperature taken and go through their health screening, they could spin a prize wheel and win things. It was really fun. I didn't win anything, but the staff really enjoyed it, and the food was great. The other thing that we did to just really recognize staff was have an appreciation day and state employee pinning ceremony for employees that had between 5 and our longest term person that was recognized had 35 years of service at Osawatomie State Hospital, somebody who's now in security but started as an activities tech and has worked in a variety of different roles. But so we put the picture up there so you could see just the event. The secretary came and participated in that, and it was really, for as busy as the place is and as much as we put on people to be there early and stay late and work overtime, there were, for all those people that were recognized, their supervisors and coworkers came to that event. It was really really inspiring to see the support for each other, and that's going to help us moving through the moratorium lift process. On slide 13, kind of our approach to how do we go from where we are now to lifting the moratorium is a lot about census management. And so we've talked and have policy underway to prevent the conditions that had us lose certification and having to put the moratorium in place in the first place. A lot of that's about just managing the capacity, patient flow in, patient flow out, and how many beds are available. So the process will be, and continues to be, you start with a screen through the Community Mental Health Center that identifies the clinical need and whether that qualified mental health professional believes that the person needs a state hospital level of care. Then they can be, a patient can be referred for an involuntary stay where the court decides that the person needs to come to a state hospital for care and treatment, or the person meets the clinical needs, but they don't have that court requirement, so they'd be a voluntary patient. So we get that level of screening, and then we'll authorize admissions at Osawatomie onto either unit, the Adair acute side or the Osawatomie licensed side, up to 85% of the capacity we have that day. So what we have staffed, what we have available as beds. If we're above 85% capacity, we're only going to take involuntary admissions. When we drop below 85%, then we can look at those voluntary patients and bring them in as well. Everybody will get screened, everybody will be assessed, but until we hit that 85% reference point, above 85%, we'll only take involuntary keep the voluntary folks on the waiting list, and then if we drop below 85%, we'll bring voluntary folks in as well. It's the same process we use at Larned. The capacity is a little different, but actually the percentage is the same. As we add beds or bring more beds online, or we can staff more safely, the total capacity will go up. We'll still use an 85% threshold to evaluate whether we bring in a voluntary patient or not. So that'll get us through. We'll still be screening voluntary patients. We'll have them eligible to be admitted, which can't happen today with the moratorium in place, and then we'll just manage the census so that we don't go over capacity going forward. And then work on, we've improved, I think, quite a bit over the last year, our reporting of the waiting list, how long people are waiting, where they're waiting from, what we're waiting for, if we need more information to make the admissions decision, communicating that back to the mental health center and the screeners. We'll keep working on that process to make sure it's transparent, so it's clear to everyone where people are on the list, when they can expect to be admitted, and what other obstacles might be in place. Mr. Chairman, that's the moratorium lift plan. There's a lot of information there. Happy to answer questions, and of course the Secretary is available as well.
All right, thank you, Mr. Brunner. First, I would just like to stipulate, as you were talking about the pay increases, that's actually on the next item on the agenda. We're going to be talking about the executive order for corrections and also the state hospitals. So if there's any questions about the pay increases that were approved by the Spark Committee and also by the State Finance Council on Friday, hold off until the next item on the agenda, because we'll be discussing that. I just wanted to go on the record that I was on the State Finance Council meeting on Friday. However, I was muted and I couldn't vote because actually I was touring the devastation in and around Paradise, Kansas, and also in Osborne, Rooks, Ellis, and Russell County. Due to the wildfires that occurred last week. I guess the first question I have would actually be for Secretary Howard. There was an announcement made last week due to an appropriation that was made a couple of years ago in regards to children's acute care beds. If you give us an update on that.
That's correct, Representative Waymaster. Thank you for reminding me about that. Yes, last week we announced that we've entered into a contract agreement with KVC Hospital Systems to open a modern psychiatric facility in Hayes. The appropriation that you all made a couple years ago, I think assumed 8 beds. We've actually agreed to a contract for 14 beds for psychiatric services for youth, and 10 of those will be on a no eject, no reject, really as SIA beds, so that there's not the ability to kind of say no to certain youth. So we're really pleased about that. It won't happen overnight. I mean, it will take they will be remodeling an existing building, creating all those things that you need to create a psychiatric hospital. So we're still probably a year out before those doors open, but it was a long, hard negotiation to get to a place with a bidder. We feel really good about that. Really, really important to have those services in Hayes. I know that's been a focus of attention of many of you over the last couple of years as well. So again, that will be 14 beds. On an ongoing basis, the funding that you approved, of the $4 million, is within the range on an ongoing basis. We did have to use some one-time funds to assist with the startup costs related to construction. So we had to add in about an additional $1.5 million of some savings that we were able to identify to pay for some of the first year one-time costs. But again, on an ongoing basis, it fits within your appropriation. There will be 14 beds in Hayes for youth.
All right, thank you for the update. I guess the next question that I have is in regards to the social detox beds. You said they're reserving 3 beds on the Adair acute care. And is that how many beds we had before the moratorium? And then my next question would be, how many of those beds do we have system-wide?
Within the state hospital system, Mr. Chairman?
Yes.
So we do, I think we've got 2 beds, but they're not reserved at Larned that we use for social detox because it does happen there. I'll need to verify, but I think 3 was how many were available before the moratorium, but let me verify that for sure.
Okay, yeah, if you could get back with us on that. Senator Billinger.
Thank you, Mr. Chairman, and thank you for being here today. And thank you for the beds in Hayes. Really appreciate that. My question is on this moratorium that was announced that was lifted, is this on all beds, or these licensed beds, or these certified beds? What are we talking here?
So, yeah, don't think so much about licensed or certified beds, Senator. Think instead of voluntary or involuntary admissions. When this moratorium was put in place in 2015, it was a moratorium on voluntary admissions. That meant that only involuntary admissions ordered through the court could go to Osawatomie State Hospital. So what our announcement that we will be lifting the moratorium on January 3rd means that we're lifting the moratorium on voluntary admissions. That means there's an ability, as Deputy Secretary Bruner said then, for individuals to be screened for admission and to enter the hospital at times where we don't need to prioritize capacity for involuntary. So, and I think in that regard, I might just also sort of make the point, I think with the addition of the SIA beds, the ability of many of those partners in the community to take both voluntary and involuntary, it just makes sense from our perspective to be able to manage across the entire system, including the beds at Osawatomie State Hospital, so we can get the best fit and match for each patient, whether they're voluntary or involuntary.
And I think it's important, too, that they are voluntary or involuntary. I think that's great. I guess my question was stemmed more from the reimbursement from Medicaid for the CMS beds. That's why I was wondering, are these CMS or are they not? Are they?
I'll let Scott speak to the addition of the new beds. When we finish all of the construction and remodeling, we will have added some certified beds to the hospital that will increase the Medicaid and Medicare billing, and Scott can give you those precise numbers again.
So when we finish the construction at Biddle, we'll be at 72 certified beds and 110 licensed beds.
Right, I see that number. I just was curious how the break was. The other concerning thing to me, and this is not just in the mental health, but across the board in our hospitals or whatever, the use of contract nursing and so forth. I think at some point in time this is going to come around to bite us, because you mentioned how you had celebrations for the folks that have been there 5 and 30 years, which is great. I think that's important. I'm glad to hear that you're doing those type things. But those folks are there overtime and everything else, putting in all this time, and then you bring somebody in to work that you're paying way more money. I just think that at some point in time is going to be a real problem. Not just in your area, but I'm talking hospitals or whatever. I've talked to people that have quit their job and they're now traveling nurses making 3 times as much money and still in the same city. I mean, and then you have the folks that have shown up there day after day after day, and I think that gets to be an issue. But thank you.
Thank you, Senator. I wouldn't disagree with anything you just said, Senator, across all of the systems that we manage.
Representative Hoffman.
Thank you, Mr. Chairman. Secretary Howard, on the mobile crisis teams, I guess I was not under the impression that we gave enough to start those teams. I thought that the appropriations that I think it was $8 million. I don't remember for sure, but that was quite a bit less than what was originally in the budget that came to appropriations. And I thought that it was only for getting the 988 system up and going, not for starting any actual teams.
Yeah, I think a couple of separate pieces, Representative. I mean, you're correct. In the 988 conversation, that's correct. Subsequent to the 988 conversation, the legislature then also funded resources connected to implementation of the CCBHCs, the Certified Community Behavioral Health Clinics. Mobile crisis is a part of that. So the CanCare piece of that really gets funded through the Medicaid program, through the funding that you supported through CCBHCs. The other funding that you provided is then what we would use to contract on the uninsured side.
Okay, so the crisis teams are being paid through the new CBHC designation.
That's correct on the CanCare side. They will be effective May 1st. That will be built into the capitated rates that the community mental health centers receive, that the CCBHCs receive, I should say.
So going forward, we shouldn't need to do an appropriation for those crisis teams? The only appropriation we would need is for the 988 system itself?
Correct.
Okay, that's good to know. And then the other thing I was wanting, the lottery vending machines, and this may not be a question for you, it's probably more for Amy. Do we know, have those caught up yet to the expenditures?
Amy or Secretary Howard, I don't know who wants to answer that question.
Actually, this has been so interesting, Representative, that during the pandemic, that we saw the actual purchase of those lotto vending machine tickets go up. So the resources actually are pretty strong in that fund. I mean, we believe that we have the resources to support the additional centers that will come on board. Now, I would caveat that depending upon what on the crisis intervention center side, that's a bit more expensive. But in terms of the crisis stabilization services, those lotto revenues have been strong. Yeah.
Well, I know we've had to backfill it the last couple of years, so I just want to make sure. Thank you, Mr. Chairman.
Do we know how much revenue has been generated from the lottery vending machines?
I don't know off the top of my head. Maybe Amy does.
Amy?
Thank you, Mr. Chairman. We can get you those exact numbers. I can tell you what was included in the consensus revenue estimates this fall, if that would be helpful. So for fiscal year 2022, we're estimating $4.5 million would be available to the Community Crisis Stabilization Fund and $6 million for fiscal year 2023, which is the maximum allowed.
All right, thank you. Representative Wolfmore.
Thank you, Mr. Chair. Thank you for a presentation. I have a few questions just to make sure I'm tracking. But first of all, thank you for all your work on this. It feels like maybe finally things are kind of coming together across the state. And thank you for doing the recognition and the thank yous and the celebrations. Every good organization does those things all the time. And you can never underestimate what that can mean to an employee, just to be thanked or get a little recognition that they might not get anywhere else in their life. So I think that's important. I hope you put a priority on that in the future. But, okay, so my first question, I'm probably not following this completely. So you said you're adding 14 beds at Osawatomie. If I'm looking at this blue chart, it's 174 in 19 and total in 182. So that's 8. What did I miss there for the 14 beds?
Mr. Brenner?
So it's the difference between the number of certified beds. So our certified capacity goes up by 12, and we add 2 more on the licensed side in the mix, but it's 14 altogether. That's the significant shift.
Okay.
The number of certified beds.
Number of certified, not necessarily total beds.
Right.
Okay,
right.
that makes sense to me. And then I think I heard you say, Secretary, that by the way, we're thrilled that the moratorium's lifted, and that's going to mean a lot to people, but where we really find the squeeze, I think, is on the involuntary beds. And so did I hear you say the involuntary would be prioritized over the voluntary?
So the way we'll manage the census at Osawatomie is we'll have a management census process where if we're at 85% of capacity, we will then prioritize involuntary. I think the other piece that will help us on the involuntary side as we go forward, in addition to the SIA hospitals that take some involuntary, will be when we're able to pull the switch on the crisis intervention services. So I'm glad that those regs are moving forward. But you're right about that.
Thank you very much. And then if I could ask another question. So on the SIA beds, or no, I'm sorry, on the CIC beds, for the waiting for the regulations, those are the same as the 72-hour hold, correct?
Yes.
Okay, I just want to make sure I have this all right. So I know RSI is ready to go. Are other places ready to go yet?
Yes, Topeka and Wichita both have indicated, they need to see the regs, but, we had some of the centers involved early before we formally submitted those regulations. And then also Lawrence, which is opening their new crisis center this spring, will be opening it as a center that's able to do both voluntary and involuntary.
So because RSI had to do some remodeling to allow that, so Topeka and Wichita, or have they started that?
Let me check to make sure if they've done, what they needed to do compared to what Kansas City needed to do. But they certainly want to be in that mix. And as I said, and Lawrence will be prepared based on the construction they're doing to do that from the beginning.
And I appreciate that, because I think that you're right, that'll take a lot of the weight off Osawatomie, right, and bragging about RSI for a minute with their beds and we don't send near the patients to OSH, so we're taking a lot of weight off that with the advent of RSI, and then with these 72-hour hold beds, it'll be significant. Thank you very much. Thank you, Mr. Chair.
All right, committee, are there any further questions for either Secretary Howard or Mr. Brunner? All right.
Great, thank you.
Thank you for the update.
Thank you so
and thanks for being here.
Thanks for your support.
We'll go ahead and move on to the next item on the agenda, and that's something that I mentioned briefly before, and that's the executive order on salary adjustments for corrections in state hospitals. As mentioned by Mr. Brunner, this was recommended by the Spark Executive Committee and approved by the State Finance Council on Friday. So I would ask the Director of Budget, Adam Proffitt, to brief the committee. Welcome to committee.
Thank you, Mr. Chair. Good morning, everybody. Appreciate the opportunity to be here. You should have in front of you some testimony from me. The cover page is a memo on my letterhead. Behind the memo is a deck that I'll be walking the committee through in pretty good detail that should answer a lot of the questions, hopefully. And if not, happy to answer any questions at the end. We also have agency representation here as well. They can speak to what the impacts are going to be for their specific agencies. As the chair mentioned, the proposal that we're putting in front of you today, or the update that we're providing today, did go in front of both Spark and State Finance Council. It was approved by both. I understand the chair was on the call and muted. I just can only assume that the vote would have been yes from him as well. So on the...
The governor asked me the same question.
What's that?
The governor asked me the same question on Friday when I spoke with her.
Very good. So we're going to break this into a couple of different pieces. So as mentioned, Spark and State Finance Council approved the funding for fiscal year 22 to carry us through the balance of this fiscal year for the entirety of the pay plan that we're talking about. One question that came up during Spark, and I'll just address it right now up front. The administration is committed to addressing the funding for fiscal 23 through the typical budgeting and legislative process. So you can expect to see something in the budget related to this for fiscal 23, and we can talk through that at a later point in time. So if you flip to the second page, it's got a bunch of boxes. This is the overview that went to the Spark committee. It's just black and white. I'm going to focus on the middle box there that says budget requested in the far left column. And this kind of sets up what the strategy is going to be. And it's really a three-pronged approach to addressing the pay at these facilities. The total request for fiscal 22 was $30.3 million. And it's broken across three different areas. So for hourly employees, there was a base pay increase that has already gone into effect for all 24/7 facilities and all KDOC specific job classes. On top of the permanent base pay increases that are already in effect, there are 4 different types of differentials that are being paid through premium pay that could be paid to specific job classes depending on where they fall within each one of these differentials. And I'll explain the details of that in subsequent slides. Then for salaried employees, to ensure that they were not left out, we propose a one-time $3,500 premium pay to go out to salaried employees. The premium pay looks a lot like a bonus as it relates to how the state defines a bonus. So we're following state statute on how we can pay out bonuses, which is how we came up with a $3,500 number. By statute, that's a maximum allowable amount in any one given fiscal year. So again, base pay increases across the board for 24/7s and KDOC specific, differentials that will be temporary, and I'll talk about how those stack in just a moment. And then salaried employees will receive a one-time bonus. If you flip to the next page, which is where we start to see the visuals, the top right should say hourly employees. So this is an overview of hourly employees, and I'll kind of set the page up, and this page and all of the other pages behind this will look very similar. So on the very bottom row there, it should be kind of a gold or goldenrod color. Anything that's in that indicates that it's a base pay increase and it's permanent and it's already in effect. On top of that, you'll see 4 different rows in blue. Those are the different differentials that we're going to speak about, and then later I'll walk you through how that impacts individual job classes. So on the very bottom here, again, base pay increase for all KDOC specific job classes and 24/7 nursing staff. And I want to make sure we're clear with nursing staff, we're talking nursing categories, LPN, RN, CNA, APRN, those types. It's not just registered nurses, it impacts the others as well. You can see the cost for fiscal 22 is estimated to be at $6.44 million. So that's already in effect, it's permanent, that will be the new market going forward. As we move up, we'll start walking through each of the differentials. And again, these are going to be temporary, and we'll determine throughout different points in time when these are needed and when they might not be needed. So differential 1 applies to all individuals at a 24/7 staff facility. So any staff that works at a state hospital, a veteran's home, the soldier's home, the correctional facility, they get differential 1 right off the bat as soon as we implement that. And what that is $1.50 an hour on top of their new base pay. You can see the cost anticipated there is $8.36 million for fiscal 22. The next differential up, differential 2, is specific to Department of Corrections uniformed security staff. So think the corrections officers that are in the state corrections institutions, facilities rather, excuse me. That's an incremental $2 an hour on top of the $1.50 an hour on top of the base pay. So then they would be now up to $3.50 an hour between the two differentials up. That's a cost of $4.96 million. Right above that, differential 3, this would be for any nursing facility staff at a 24/7 facility. So anybody that falls into one of those nursing classifications that I spoke to earlier at a 24/7 staff or facility, excuse me, gets an incremental $4.50 per hour. And the differential 4 is for any 24/7 facility that is designated as a critical staffing levels. And we've identified that right now as 25% vacancy rate. One of the questions that came to us was if you're at 25.2% vacancy rate and you have one individual walk in the door, now you're at 23.8% vacancy rate, does that go away automatically? The answer candidly is no. It's not going to happen that day. We'll review, we're going to look at this kind of on a time continuum and see what the need is going to be. We'll average it out over time. But that differential will be $2.50 an hour for all individuals in those facilities. So that's hourly employees. If we flip the page to the next one, on the very top right, it should say salaried employees. This one's quite simpler. This is a $3,500 one-time premium pay adjustment that will be paid out to salaried employees at these facilities. And again, the premium pay looks close enough to state bonus that we're following state bonus guidelines and the federal premium pay guidelines as well. That should be paid out this fiscal year, and it's a one-time money. So if we move to the next page, at the very top left, it should say 24/7 facility pay plan example, corrections officer 1A. And it looks just like the first page I showed you. So we call these the CO1As, the corrections officer 1As. This is a real-life example of what a Corrections Officer 1A would see through this pay plan. So again, if we start at the very bottom, the goldenrod, the base pay increase, they would be a part of this. Now, I need to be clear that with the CO1As, we didn't increase the starting pay. We left that at $18.26 an hour because that mirrors what the Larned State Hospital security staff is at, so we want to make sure they're consistent there. Instead, what we did is at 3 months in, there's a 2.5% adjustment up. At 9 months in, that employee gets another 2.5% adjustment up. Then at 12 months in, they're moving to a new job classification for 5% up. So that's how we identify that as a base pay increase. 3 months, there's an increase. 9 months, there's an increase. 12 months, there's an increase. So if this individual, then, if you look at differential 1, that's going to stack on top of the base pay increase. They are at a 24/7 facility staff, so they get this. That's an incremental $1.50 an hour on top of their new base pay. They are a Department of Corrections uniform security staff, so they get differential 2. That's an incremental $2 an hour on top of differential 1. You can see that in the white arrow out to the side. Go up 1 box to differential 3. That's specific to nursing, so they do not get this differential. That box is blacked out. The arrow is blacked out there. Differential 4, should they work at a facility that is at critical staffing levels, again, over 25% vacancy rate, they're also going to get this $2.50 an hour increase. So the green box at the top will show you what the new hourly rate would be should they get all of these differentials on top of the base pay. And they would go from the $18.26 starting all the way to $24.26 an hour with all the differentials. And then after 3 months, again, they get the 2.5% applied to their base, so their salary would be $24.70. And at 9 months, they get an additional 2.5% on top of their base, which would take them to $25.16 after 9 months. So that's how this pay plan impacts a CO1A with Department of Corrections. We wanted to make sure it was meaningful, and it certainly is, going from $18.26 up to $24.26. So if we move forward, I won't walk through all of these because the mechanics are the same, but we will go to the very back page and focus on registered nurses or the nursing staff. So again, same setup as what we've had. The goldenrod at the bottom is the base pay increase. And for reference, nursing staff largely got about a 10% increase. So that would be their base pay increase. Starting salary would be about $30.80 an hour. Differential 1, they do work at a 24/7 facility staff, so they get that $1.50 an hour on top of their base. They are not uniform correction staff, so they do not get differential number 2. You see that arrow is blacked out. Differential 3, they are nursing staff, so they get that differential of $4.50 an hour on top of the others. And if they happen to work at a facility that is at critical staffing levels, then they're also going to get the incremental $2.50 an hour. So their new rate, if they had all 3 differentials applied, would be at $39.30 an hour. So again, making meaningful impact, going from $30 an hour up to $39 an hour. There was a question during the Spark Committee about how this compares to private sector. The only data point that I had available to me at the time was traveling nurses. Traveling nurses, the market average right now is $48 an hour starting pay. So we're still below the $48 an hour, but we're a heck of a lot closer at $40 an hour for these nurses than we would have been at $30 an hour. Keep in mind also that with some traveling nurses, they don't get the fringe benefit on top of that with insurance and some of the other measures. So they're giving up some of that to get more dollars. Our nurses are getting the fringe on top of the $38 an hour. So it's much more closely aligned. There was another question about, and I'll just address it here, is this really going to be temporary, everything in the blue box? The answer is that's our goal, is for this to be temporary. The base pay we felt was warranted and needed. The base pay was too low, so we made a quick action, and that went into effect already. That is now the new state market for salaries in these positions. We didn't want to have a wild swing and make all the other differentials permanent today, not knowing what the market is going to bring in 6, 9, 12 months, and not knowing what the staffing levels are going to bring in 6, 9, 12 months. This plan and all of the mechanics contained within it, being temporary on some and permanent on others, was clearly communicated to the agency leadership. It was also clearly communicated to KOS so that they had sign off as well on what we were doing moving forward. So again, wanted to make meaningful change. This is a very, very immediate need. It's a very large public safety concern at the corrections institutes, and then also a health concern at some of the state hospitals and the veterans homes. So wanted to make sure that we address a very, very immediate need, but we didn't swing the base too far, too quickly, and we can come back and readdress down the road. And with that, Mr. Chair, I'm happy to answer any questions now, or if you'd rather have the agency speak first, then I can come back later.
Actually, let's ask some questions for you, and then if any of the individuals from the particular agencies want to chime in, they can just go ahead if it's more pertinent towards their agency. But the first question that I have is, how many facilities do we have that would be designated as critical staffing level?
Thank you for the question, sir. Right now, with the state hospitals, Osawatomie, and this data is 10 days old, so it would be updated as we go along. For the hospitals, Osawatomie was at 40%, Larned was at 38.1%, so those would qualify. Corrections, El Dorado was at 34%, Ellsworth at 31%, Lansing at 25%, and Larned was at 23%, so just under the threshold. But to keep it consistent with Larned State Hospital, we would call that critical staffing. And then for the veterans homes, both the veterans home and the Kansas Soldiers home were pretty high as well. 27% overall, but the CNAs had a 42% vacancy rate, so a really, really critical need with the CNAs.
All right, thank you. Committee, any questions? Representative Hoffman.
Thank you, Mr. Chairman. I wasn't able to listen in when they talked about this in the Spark or the State Finance, but I know when I talked to the individual that called me before can't think now who it was, but called me before the governor made this announcement, I brought up we're looking at $30 million for fiscal year 22, which is only half, and your numbers are showing that. It would be $60 million for 23 if you kept all of this in place for the whole fiscal year. Am I correct on that? Or approximately?
It'd be relatively close. There's timing with the pay periods and when things get implemented, but it'd be ballpark. So
I guess my question, and I'm probably reiterating what was talked about in Spark, I suppose, to a certain extent. I can understand there's a clear matrix for the 25% vacancy rate and when that would go away, but there's nothing clear about the other three, Tier 1, Tier 2, and Tier 3. So who's going to decide when they're no longer temporary, I guess? And are we going to be asked in appropriations for the full 60 million when in anticipation that it's going to be most of the year?
Sure. Very good questions. I'll work backwards if that's okay. So I should also clarify that the cost, the $30.3 million, contemplates that all of the differentials are in place for the remainder of the fiscal year. So to the extent that one of the facilities might fall down to 15%, we would be showing some savings there. And so this was really an up to approval. So as it relates to the budget for fiscal 23, again, we'll contemplate that with the budget process. I would anticipate seeing a request that would cover the full freight of the cost for the entirety of the year. But that doesn't say that we're going to have this in place for the entirety of the year. Just want to make sure that we have everything covered. For your other question on who makes the determination and when on the other three differentials, that's candidly kind of up in the air right now. I don't view that as a unilateral decision from my standpoint or the director of OPS. I think we'd have conversations with each of the agency heads to see how this is impacting staff, making sure that it is having the intended impact and making sure that staffing is getting back to levels that we need and that we're able to provide the care to those individuals in these facilities. So a lot of conversation and certainly plan to be 100% transparent with the legislature as we move forward.
Well, I appreciate that. I really have a little bit of heartburn about making that big of a pay increase temporary. I have my druthers I have my doubts whether it'll ever go away totally, because it's just hard to give someone that big of a pay increase when you're talking some of them. It's about $4, $5, $6, about $7, $8 an hour, and then they have it for a few months or a year, and then it goes away. So I really have some doubts about some of this, but I'm not saying it doesn't need to be done. It's just to say it's temporary is maybe a little bit of a fallacy.
Representative Wolfmore.
Thank you, Mr. Chair. To kind of follow up on what Representative Hoffman said, first of all, I completely support what you've done because it's critical levels. I mean, we can't, no use opening up extra beds of SWATomy if nobody's there to serve the patients, and that's really where we're at there. But I guess my question is, since this is temporary, is it being clearly communicated to all the employees that this impacts so that there's not an expectation? Because the last thing we'd want to happen is for the rug be pulled out from under them, you know, financially. They're thinking this is a permanent sort of thing, and we don't know if it will be. So that would be my question.
Sure. Again, I would just reiterate that, yes, the communication was very clear, at least from the administration and the media release that went out that the governor put out. I've spoken with Secretary Zamuda and the others, and they've indicated they had good conversation with the staff. Again, we worked with COAST to ensure that they were on board with this and they understood the mechanics, both the permanent and the temporary. And I don't anticipate a scenario in which we would just make a decision and shut it off the very next pay period. I think we will also clearly communicate the timelines once we know them, what it's going to be. But again, we wanted to make sure that the number one priority, address this very critical need right now, today, to stem the tide and make sure that we take care of the folks, both state employees and those that are being cared for by state employees. Also, we wanted to make sure that we didn't completely reset the market on a permanent basis, that we had time to see how this is going to work. And keep in mind also that, and Secretary Zamuda can speak to this a lot better than I can, but they've had staff on 12-hour shifts and very long shifts since July. So if we can get this stabilized, people can start to get some of their life back as well, not being at work 12 hours a day, 6-7 days a week, and that goes a long ways as well.
And so then my follow-up would be on COAST. I'm glad you communicated with them, and you have a commitment from them that they understand that if this is a temporary thing, that they will not cause undue problems.
So I don't want to speak for them. I wasn't a part of that conversation personally. I know others in the administration were. They were supportive of it, specifically in the governor's release, and understand the mechanics quite well.
Okay, thank you very much. Thank you, Mr. Chair.
Representative Johnson.
Thank you, Mr. Chair, and thanks for laying things out. I know this one is not easy. The first question would be, what was the base pay increase amount? And if I just look at maybe your first example to start there.
Yeah, so I'll use general numbers first, and then I'll get into the specifics. So by and large, Department of Corrections got a 5% increase, but so there were a few classifications to avoid compression issues that got a 10% increase. So think of PO, the parole officers and the corrections officers too were about a 10%. Again, in example one, the CO1A or Corrections Officer 1A, the starting pay did not increase, but what we did is, as an incentive, at 3 months of employment, there's an automatic increase of 2.5% to the base pay. And then at 9 months of employment, there's another 2.5% increase automatic to the base pay. At 12 months, it moves into a different job classification, CO1B, that's another 5%. So within that first 12 months, you're looking at just over 10% increase on the base pay for that particular job classification.
Thank you. Thanks. I was trying to get a handle on that, and I share the same concern of my colleagues. And rather than reiterate that, figuring out how we do it, the other question that I have, which is hard to get my head wrapped around, and I don't know if anybody has thought about it a lot, as an employer in the market, as we change our pay, we change the market. So as we make it, even if it is temporary, what impact do we have on other employers, and how does that affect our ability to, even in layers, pull all of it back, pull some of it back, as we try to say, how does this long-term affect wage inflation where we're hiring it, and have we had a chance to look at how we address that with the temporary portion while not trying to hamstring you and meeting the needs. And thanks for laying that out. And thanks to the employee for doing the work and those that we still have. So I don't want to diminish that at all. But I do want to take kind of a macro look at the impact on wages.
Thank you, Representative Johnson. Completely understand the concern and agree with it. I hate to keep going back to the same answer, but again, we made the base pay increase to what we think the market could bear, ongoing. The temporary ones, hopefully, as things stabilize, will be temporary and could back down at some point in time. We don't know where the market, how tight it's going to be in 6 or 9 months. Clearly, right now, it's a seller's market, right? I mean, folks can go out and pick up jobs at pretty much whatever they need to. So it's something that we are acutely aware of. Craig Knowlton, the Director of Personnel Services, is here. He and his team do a market survey annually, if not more often, and we have a lot of conversations about that and ensuring that we're not overshooting the private sector so as to compete with ourselves in the long term. So that's not a solid answer, but rest assured that we are aware of it, we're reviewing it, and we're reacting as quickly as we can to it.
Senator Clays, did you have a question?
No, I'm good, thank you.
It's online, but I just kind of wanted to, if he does have a question, we'll go back to it. I didn't know if Deputy Secretary Brunner wanted to make any additional comments, or Secretary Zamuda, in regards to the pay increase.
Thank you for the opportunity. I don't have a lot to add to what the budget director said. I think he characterized it well. Would just call out what was in my testimony for our MHDD position classifications at the other 3 state hospitals other than Larned. They were increased over the summer, so they're starting from that higher place, and then the additions go on top of that that you mentioned. We have looked at kind of the market rate as well as we were assessing contract nurses, kind of some of the other issues that I talked about, and we think that this, with the temporary increases, it puts us in a good competitive place for introductory new nurses right out of school with little experience compared to other healthcare employers in the greater Kansas City, eastern Kansas market that we're trying to recruit from. So we feel good about where it places us. Appreciate the support from the governor's office and the finance council and the Spark committee. There are concerns about the temporary nature of it and how we communicate that. We kind of know how to market when we're recruiting nurses with a higher base pay. We're trying to figure out how do we advertise here's a temporary increase in the hourly wages, but we'll work through that. It's a good problem to have. But thank you for the opportunity to comment.
All right, thank you, Deputy Secretary. Secretary Zamuda, do you want to make any additional comments?
Thank you, Mr. Chairman, members of the committee. Jeff Zamuda, I'm the Secretary of Corrections. I have a few remarks and just a little bit of information, and I'll be brief. I do believe the 24/7 facility plan will have a strong impact on our current situation and help address the staffing needs for our agency and our workforce. We've traditionally struggled to recruit and retain a workforce in corrections, but recently we've reached a tipping point and seen vacancies at a level I've not seen in my entire career. Fatigue and current compensation continue to contribute to the rise of the number of vacancies in uniform positions. And as Director Profit referenced in his remarks, staff at the El Dorado and Lansing correctional facilities have been working 12-hour shifts, and they've been working those since latter part of July. Over the first 23 weeks of the fiscal year, vacancies have increased 21 of those 23 weeks. We've seen 3 weeks where increases in separations resulted in 20 fewer staff, in excess of 20. As of December 13th, we had 458 vacant uniform officer positions and 68 vacant non-uniform positions in our correctional facilities. Facility vacancies are the highest at our El Dorado facility, and that's at 35.6%, and they're the lowest at our Winfield facility, which is about 11.3%. The average across adult correctional facilities is about 25.5%. We're not alone in our staffing shortages. Corrections throughout the nation is struggling to staff their facilities. That includes our neighbors to the north and east of us in Nebraska and Missouri, just to name a couple. And given the extraordinary circumstances of these vacancies, managing the pandemic, we really need to invest in our workforce. I want to thank Governor Kelly, legislative leadership, members of the Spark Executive Committee, and the State Finance Council for their support and leadership in approving immediate funding for FY22. I also want to thank the Joint Committee on Corrections and Juvenile Justice Oversight. In October, we appeared before that committee and presented a bunch of information to include information regarding our staffing. And that committee made a number of recommendations, which at least in part, this staffing plan will help address. The plan addresses our staffing needs primarily in our three largest portions of our labor force where we need the most help. That is with uniformed correctional officers, our unit team staff or counselors, reentry, those type folks, and parole. The design of the plan and the funding approved is a bold first step in helping address a pay structure that today is just not competitive in the market out there. Again, I appreciate the opportunity to appear before you, Mr. Chairman, and I stand for any questions you might have.
All right, thank you, Mr. Secretary. I'm going to open it up and see if General Turner with the Kansas Commission on Veterans Affairs has any questions. I believe he's joining us virtually.
Yes, Mr. Chairman, members of the committee, thank you. I have been working with each of the members here of the team and in complete concurrence and agreement with all. I don't think I have much more to add. I think that our leadership out at the various hospitals and state veterans homes will make a great difference, I think, in the implementing of it as I hear you discuss the various challenges. But there's tremendous opportunities there too, I think, for folks to work in good environments and for, at least in our case, I know with the opportunity to serve veterans is a great privilege and honor. So we look forward to that and thank you all again for all. Thank you very much.
All right, thank you, General Turner. Is Ms. Hewitt with you as well?
Sir, she is at a separate location. I think she is monitoring as well.
Okay, I just didn't know if she had any comments that she wanted to make or not. Committee, are there any questions that you may have for either Deputy Secretary Brunner, Secretary Zamuda, or General Turner? Senator Billinger.
Thank you, Mr. Chairman, and actually it's for Adam. Yeah, I have similar concerns as my colleagues up here on these temporary type deals. Did you guys look at maybe a sign-on bonus where you pay them once and you could use the same steps, at 3 months, at 6 months, and 12 months? It kind of keeps you from painting yourself into a corner because it seems to me like with inflation, it's going to be just back and forth between the public sector and the private sector. Sure.
No, thank you, Senator. I appreciate the concern. And yeah, the short answer is there were a multitude of options discussed. I think it was Secretary Zamuda mentioned Nebraska and Missouri. So we reviewed what their pay plans were. Nebraska actually went quite a bit further than we did. They were, I don't want to quote their percent, but it was in the high double digits percent, and it was permanent for all 24/7 facilities. So we looked closely at what that was and wanted to make sure, again, that we didn't overshoot. As it relates to sign-on bonuses, again, Kansas statute sort of restricts how we can dole out bonuses. It's $3,500 per fiscal year, capped, and it's discretionary. You can't have any strings attached to it. So it can't be here's a sign-on bonus, make sure that you're here for 9 months to retain the entirety of that bonus or pay it back, like you might see in the private sector. I've had some of those where you get the bonus and then if you don't stay, you pay it back. So with the increase in pay, it felt like a good strategy to make sure that folks are staying around and ensuring that they felt appreciated and make sure that they know they're going to have that money coming in over time until such time that we're able to stabilize and get a stronger workforce. Yeah,
my concern is the day you go in and tell them, so you're no longer getting this. how many of them stick around or go somewhere else where somebody else is offering another bonus or whatever? But it's going to be challenging. I mean, I think going forward, it's with the way, especially with what's going on with inflation, it's going to be a terrible challenge. Thank you.
Senator Hawk.
Thank you, Mr. Chairman. How many employees would you guess, we've talked about 12-hour days, have been getting overtime pay during this crisis in our facilities? And do we think that these increases will reduce that overtime pay?
I will, as Secretary Zamuda is walking up here to answer that, hopefully, I will point to one of my earliest slides that says hourly employees on the top right corner. In each of the boxes, it talks about how many individuals are going to be touched by each of those differentials. So that gives you a baseline for the scope of how large this is. But if it's okay with the chair, I turn it to Secretary Zamuda.
That's fine.
Thank you.
Thank you, Mr. Chairman. Senator, I don't have the exact number of uniform staff that are being impacted by the overtime, and we can get that number. What I would say is it's system-wide. We're experiencing that overtime. And I don't remember the second part of your question.
I probably didn't ask it very clearly. I'm guessing we don't really know because we don't know what our intent is. We won't lose people and we'll have more people apply. But I don't know what the labor pool is in terms of availability. So I could see potentially, we're hoping that this gives us a larger labor pool and more people can come in and less overtime. But my question is, what if it doesn't? I'm guessing we may still have the need for some of those longer days for hopefully not all of these people, but a substantial number. And I just wondered if you thought that thinking was correct or not. I hope it's not. But
Mr. Chairman, Senator, I think what the plan will do for us immediately is help stabilize us with our current employees, maybe stem the tide of the number of people that are leaving. I'm hopeful that'll happen, and then also help us in our efforts to recruit. We've really had a challenge recruiting in the current dynamics that are out there in the workforce, much like the private sector, much like other government entities. What I am concerned about is the collective fatigue on our staff that are working fairly large amounts of overtime. It's taking a physical and mental toll on them. So we've really got to get after trying to get some relief, get some new hires in, and increase our staffing level to diminish that amount that needs to be worked over. That's a real factor for us.
no, and thank you. And I certainly support you and our other agency heads and the governor and Spark and the State Finance Council for addressing this problem. I think it's critical that we address it. It's just a very difficult problem. So thank you.
Thank you.
Okay, and I had a message from Senator Clays. His question has been answered. And I'm not seeing any further questions from the committee members. So thank you all for being here and discussing the salary adjustments. We'll go ahead and move on to the next item on the agenda, and that is state indebtedness. So I would ask Jim McMurray, the Senior Vice President with the Kansas Development Finance Authority. Welcome to committee.
Thank you, Mr. Chairman, and members of the committee. In terms of material prepared for this appearance, I did an update on the 2020 Kansas debt study that I presented back early in the session at the beginning of the year. The only portions that were updated is I went through all the appendices and added, as you can see on the title slide, revision dated December 17th, added to appendix tables bond balances at December 31st this year, 2021. So that'll be an 18-month increment from the report that was done earlier this year, and then added information on optional call dates, call price, bonds that are called, and final maturity for those bonds, and then also added in some of our recent transactions. So assuming that the main report is pretty familiar with material for you all. In the first place, I would probably steer back to the second to last page, which is appendix page A4, and it relates to state general fund supported debt. And on this table, we can find we've done 2 refunding transactions in the last 18 months for state general fund debt. So, for example, you can see that Series 2010 E and F, 2010 O as an Oscar, 2011 B as in boy, 2013 A have all been refunded within the last 18 months. You can see the actual dates they were called in the second to last column and what the call dates and prices were in the 2 columns before then. In terms of series that have been issued since the end of fiscal 20, there were the 2 refunding transactions that took out those 4 series above, and also the Capers transaction. And then you can see the tally for state general fund appropriation debt as of the end of fiscal 20, which is 1.9 million. And now we're projected 18 months later to be around 2.3 billion. That $371 million increase is primarily driven by the $500 million Capers transaction. And then in terms of bond series that are callable in the near term, 2015 A is an Apple and 2015 G is in Golf. You can see some large transactions we did in early calendar 15 that have balances around $170 million each, have call dates in the spring of 2023, therefore fiscal 23 at a par call of 100%. If you're looking to do anything in terms of paying off debt early, those are the most likely targets in terms of state general fund debt. I can certainly speak to other types of debt the state has in terms of KDFA issued bonds, and then one of the tables here in the appendices does cover KDOT debt and those call dates. But those are the extent, unless you want me to go through the entire debt study, those were the items I wanted to highlight and perhaps engage in a discussion with you, what your thoughts are, what you would like us to look at specifically.
The main focus that I would like to focus on is actually state general fund debt and that the financing of that from the state general fund. So if you can go through that, I don't necessarily need to go through the user fee funded debt or the debt that is in the university or the Board of Regents system, mainly those debts that are serviced by the state general fund.
Right, so going back to where we were at Appendix A4, you can see the series listed that are debt service from state general fund appropriation. There are several series that were done to provide Capers deposits. And each of those series are taxable bonds, and each of them have a make whole call provision, which makes it uneconomical to call those bonds early. You are able to call the bonds, but you're paying, you're not getting an economic gain by doing so. We can certainly run those calculations, but that is the largest composition of the outstanding balances, around $330 million from the 2004 series, just over $900 million from the 2015, and then none of the most recent transaction has amortized yet, so that's just over $500 million. The rows 2 through 5, those were the 4 transactions that we did redeem and called and refinanced for economic gain over the last 18 months. The next 2 rows 2015A and 15G, as I previously discussed, those would be your targets of opportunity right now in terms of extinguishing debt early or doing a refunding transaction for economic gain that could be done in fiscal 23. And that leaves us with Series 2016H, which has an optional call date in November 2024. 2019 F and G with call dates in 27 and 2020, R and S with call dates in 2028, and finally, a series we just did, 2021 P, has a call date in 2030.
All right, thank you. I know that Director Thompson is here. I saw him in the back. I didn't know if you had anything that you wanted to add in regards to the state indebtedness. Committee, he does have testimony that's supplied in your packets as well. Director Thompson.
Good morning, Mr. Chairman, members of the committee. I don't have a formal presentation for you today. We did provide some information about a bond issue that we have that financed our forensic laboratory about 4 years ago. But I would be happy to stand for any questions that you might have. And I would note that we have an optional redemption date of December 1st, 2021, if that was of interest to the committee, if there was an interest in trying to reduce debt at this point.
Right. Thank you, Director Thompson. I think we'll go ahead and open up for questions. I know that the Executive Director for Contracts and Finance with the Kansas Department of Corrections is available for questions, as well as the Executive Officer for the KBI, Robert Jacobs, and also the CFO, Paul Weiss-Gerber. So, Representative Johnson, we'll go ahead and open questions.
Thank you, Mr. Chair, and thanks for the information. And Mr. McMurray, I'd start as you were on A4. The two that we would still have a chance, because we've already refinanced the others, but on the 2023 call dates, what's the interest rate that we have on 2015 A and G?
Most of those bonds have 5% coupons.
Okay. And if we were to refinance them in the current market, which I know may not be relevant a year out, where might we be in those?
With 5% coupons, I would guess savings would be in around 20% of called par. So just doing some mental math real quick, call it 350 million, 20% on that would be around $70 million net present value savings, maybe.
And somewhere around a little over 1% in interest in terms of the issue?
In terms of the yield on the refunding bonds?
Yeah, from 5%.
I would guess closer than 1.5, 1.75.
Okay. So thank you for that. But our first opportunity would be looking at next year on those 2023 bonds.
Right, and if you're doing a refunding transaction, you're not necessarily reducing the amount of your debt, you're just refinancing and have a lower yield. You know, if you have excess cash, you can just pay them off.
Right. So it might be something that we could choose to reserve funds for to be able to pay those off, depending on if the market doesn't stay favorable for us. So. Similarly, if I do take a look in the KDOT transaction on the next page, it looks like we have one that comes up in a year in 2022, and I know that's not in KDFA's purview necessarily, but do you know what our rate might be on that bond, which would be the 2012C?
Yeah, I don't know off the top of my head, no.
Okay, but we could assume it'd be in the 2012 rates when the 2015 rates give us something instructive in terms of how competitive the rate would have been at that issue time.
Right, and I don't know what, if you look at that one, the final amortization's in 2032. There's around 10 years left. I don't know if it's a level amortization. That's be around 60 million a year. So certainly an economical refunding transaction. I just don't know that's going to be a huge number, given it's only 10 more years.
Okay. Thank you for pointing that out. I appreciate it. And if I may, on one other set, in the other taxpayer-supported debt, it looked like it's a tiny transaction. It looks like we did the one in 2019. Is it even worth looking at something as small as what was issued in the 2002 H series?
There's only $270,000 left on that, right? And as far as I know, we did look at refunding that with other series, and the repayment stream, it became complicated in terms of what the actual obligation of repayment would be. We couldn't necessarily blend it with anything else, and it was just too small to do by itself.
But could be something we'd look at just paying off potentially?
Yes, you could do that right now.
And so the interest rate might be useful just to see what that tiny amount is costing us as more of a note in the budget than anything, I know, due to the size, but thanks for the chance to look at that. And I assume as we look at all of the others for the user fees that your team continues to assess where there's an opportunity to reduce the interest costs, just as you have with all of the others that were noted, right?
Yes, that's correct. We had a Moody's rating call for Pittsburgh State University refunding this past week. We're teeing up the Kansas State University, and then we're on University of Kansas radar for their May 1st, 2022 callable bonds.
Thanks. And then what we may be able to add to that strategy that's already happening is to say something such as, just as an example, that $270,000 on the 2002 series might be added to the budget to eliminate debt rather than refinance.
Yeah, it's probably already in the budget. Its final maturity is 2022, if you look at the far right column. So it's probably already budgeted payoff this year.
Gotcha. Thank you. Thank you, Mr. Chair.
Yep.
Kind of going off an extension of Representative Johnson's questions, and this may be more of a question for the Director of Budget, because I see you still in the audience. Obviously, I think everybody knows where the ending balance is for the state of Kansas as of fiscal year 2022, and we're going to be entering the legislative session into 2023 with a ending balance that I think has not been foreseen in the state's history. And so I guess one would be a question for Director Profit. I believe it was 2 years ago, if you look at the tax-supported debt 2020T, the impact bonds, that was in the governor's budget to pay that off. Is my memory serving me correct?
I would have to, thank you, Mr. Chair, Adam Profit. I would have to go back and look at the budget presentation from that year, but that does sound familiar. I think it's the 2019 budget, if I'm not mistaken.
I'm showing that the final maturity is 2022. Mm-hmm. So I guess my next question, either you can answer it, Director Profit, or Mr. McMurray. When we're going through the budgeting process, and we look at all the surrounding states in the Midwest, central Midwestern region, we are definitely the highest in regards to tax-supported debt compared to our neighboring states. If we would look at paying off some of the debt that the state currently has, I mean, we can look at the ones that have the closest maturity date to where we are right now, but would there be any type of, I guess, preference to any debt that you would possibly suggest to be paid off?
Yes, if the state has resources to pay off debt early, or it would go back to the 2015A and 2015G series that have optional redemption dates in the spring of 2023.
But anything, I mean, any particular item that specifically to be paid off? That you could think of right now? I know I'm kind of asking you on the spot, but.
By bond series, or what the original use of the proceeds were?
Bond series.
2015A and 2015G.
Okay, thank you. Committee, any further questions? Representative Hoffman.
Thank you, Mr. Chairman. So I'm trying to find the KBI. my mind went blank. The KBI's debt. Where is that? Because it's not general fund, and I'm not finding the user fees either. So
Right, so I generate my report based off of the state's annual comprehensive financial report. And I go to the long-term obligations section, and there are several tables in there that list all the series. And I do not find the Topeka Public Building Commission Series 13 listed separately. It's probably somewhere in the long-term obligations, but I don't have a tally in this report specifically for that series, so it's not included in my report.
okay, so maybe it's a question for Director Thompson. What is that paid? Is that user fee, or is that a state general fund obligation?
Representative, that's a state general fund obligation.
Okay. The 4.3 million? Okay, that's what I need to know. Thank you.
Senator Billinger.
Thank you, Mr. Chairman. Mr. Thompson, do you know what the amount was on that?
I'm sorry, Senator, I didn't hear your question.
I believe we said there was a call option on that for 2021. Do you know what the amount is?
It's $41,205,000.
41. Thank you.
I'm going to recircle back to kind of my initial question, and this would be for probably Director Profit. I know that you were not listed as being an individual to answer questions, but I'm just kind of wondering in regards to the impact that this would probably have on the state highway fund. So if I'm hypothetically speaking, let's look at the bond for the state capitol. I believe somewhere I saw where it was originally the balance is it 327 million? I can't find it right now. Let's just say we pay that bond off on this building. What would the impact be to the Kansas Department of Transportation if they did not have that debt service that they had in their books?
I'm sorry, Mr. Chair. Are you on table A4 or A5?
Well, I was kind of going off my memory, but
I can't see that.
I thought I saw somewhere in here where let's do a hypothetical. Let's say the balance is 327 million on the state capitol building. That is serviced by the Kansas Department, the Highway Fund, correct?
Correct.
Paying that bond service. So what would be the impact if that particular bond was paid off towards the Kansas Department of Transportation?
Mr. Chair, I would have to look at the analysis provided by Mr. McMurray. Certainly happy to do so. If memory serves correctly, I think I recall Secretary Lorenz saying, I'm going to get the number wrong, it was either $15 or $20 million of annual debt service paid for from KDOT to that bond. So I would suspect it to be in the neighborhood of 15 or 20. To the extent that it makes economic sense on the provisions of the call, we'd have to review that.
No, and I completely understand. I just wanted to see what the impact, because they're servicing that bond. Correct. And I just wanted to know what that would potentially be for the Kansas Department of Transportation. Oh, Senator Billinger actually found it for me. It is on page 6. Senator Johnson. Representative Johnson, did you have a question?
Thank you, Mr. Chair, and I would go back to Director Thompson for a moment, unless Mr. McMurray had something to add before I get there.
Just as a point of clarification, there were many different series of bonds that financed the state capitol renovation stemming all the way back to 2000. And that was done several transactions to aggregate to 327 million, and all along the way, it was mixed in with other projects. So there unfortunately is not just one bond that we can point to and say that is the state capital bonds. It's all blended in with that large debt portfolio for the state general fund. The only series that are truly distinct right now are pretty much the CAPER series. And then in terms of page 6, I think that's just probably mixing in what was done back in 2006. Give me a moment here. One of the bullets, one of the bullets talks about the capital restoration project at 327 million, but like I said, that can't be isolated to just one of the outstanding series we have right now. It's just all blended in with there. Sorry to divert, but wanted to get that there.
And since Mr. McMurray is there, I'll just start with you, and you may have the information as well. On the bond for KBI, it was issued through the Topeka Public Building Commission. So is that another entity that issues bonds like KDFA?
In terms of being an issuer, yes, they're an issuer, but I think the comparison ends right there. They don't have a full-time staff. It's just a commission that's appointed by the city commission that can act as a conduit issuer. You don't have a professional staff there looking ahead of time for these refunding opportunities.
Okay, but this one then was not issued or handled by KDFA, am I reading that right?
That is correct.
So how many other entities might, given that we have the report from KDFA, how many other entities might there be that we issue bonds through that are committed by the general fund that
by the general fund, I'm not aware of any others. In terms of financing activities that may not involve bonds, but like long-term leases or other types of arrangements, there certainly have been a few out there. The most notable being the Lansing project.
Have there been other entities like the Topeka Public Building Commission that we've partnered with on issuing bonds that are related outside of general fund obligations?
If you recall, the KU Central District project used a out-of-state issuer called the Wisconsin Public Finance Authority, which is basically just a gun for hire in terms of getting transactions done.
Okay, thank you. I appreciate that. I'd have some concern. I think KDFA does a great job of issuing bonds of what reasons we would have to go outside of that. But if I may, for the director, two questions I have. One is if you know what the interest rate is on that bond.
It is approximately 5%.
Approximately 5, thank you. And then do you know why we went with the Topeka Public Building Commission rather than KDFA, and how that process works and how that fits together, and where we might find it if it's not on the KDFA report, and you're not helpful to bring it, not that you would ever not be helpful, but to bring it to our attention so that we know.
When we initially began our process of trying to find funding for a new forensic laboratory, to be quite frank, there was some concern about additional debt on the state's books. And so there was an interest in using another entity, and Topeka Public Building Commission had provided funding for a couple of other state buildings. So they were kind of familiar with the process. It also involved another entity, Washburn University, that was a part of this proposal. So all of those things kind of came together that the Topeka Public Building Commission was the best solution at that point in time to do this. Hope that answers your question.
All right. I think we've had a pretty good discussion. I just wanted to reiterate the hypothetical idea that I had in regards, or mentioned in regards to the state capitol. I wanted to see what the impact would be on another agency. Completely understand that there are numerous bonds in regards to that, but it was just a hypothetical example of if we would potentially pay that off, what the impact would be to the Kansas Department of Transportation. Also, I'd like to, in regards to Representative Johnson's questions in regards to why would we go out or why would some entities go out with a different agency or bonding authority instead of the KDFA. I recall when the University of Kansas went out with the Central Business District bond. That was actually done through the foundation, if I recall. I'm looking at Representative Wolfmore because she was on the committee when we had that discussion here. And that's why, and they wanted to expedite the process as well. And that's why they went with the entity in Wisconsin. Because we had a very lengthy conversation about that in this committee room when that occurred. All right, we're going to go ahead and move on. I'm going to turn it over to Dylan Deere, who is going to give us the fiscal year date spending. Dylan?
Thank you very much, Mr. Chairman. You should have a salmon sheet inside your folders there. I tucked it in towards the back, so you're going to find it there. It was easier than trying to sort through all the other paperwork. Well, if everybody's ready, for the last couple of years, we've presented a report on how agencies are spending their state general fund budgets against the approved budgets. The purpose of the report is just to sort of highlight areas of maybe concern before we get there. The key finding of this report is that overall SGF expenditures closely match expenditure patterns as compared to the reference years. So for our reference years through November, it had been about 48.6% for FY 2018 and FY 2019, and we're currently at 48.1%. So within 0.5% of the sort of reference years for state general fund spending. We did exclude FY 21, FY 22, because as a result of FY 2021, as a result of the COVID-19 pandemic, those years were very irregular, and so they weren't, very effective to use. In the table you can see here, these are the select agency comparisons in which there had been some degree of variation. The first column is the average on FY 2018 and FY 2019, and the second column is how much of the SGF budget has been expended as in FY 2022. So if you look at like bids at 30.9%, that's below the 41.7%, so that means they're spending less. And if you look at the Kansas Board of Regents, they're at 65.2 as opposed to the reference years, which were 47.6, which means they're spending more than those reference years. If everyone understands the general format of the analysis, I'll go ahead and move on to the materials. So if you look at bids, they're about 10.7% below the average expenditure level. This is primarily attributable to carryover funding and the assigned council caseloads. That caseloads was presented last meeting of the LBC, and it has a lapse of about $4.6 million that's built into that caseload estimate. If you look at the Kansas Board of Regents, they're about 17.7% above the average. There's a bunch of new funding inside of the Board of Regents, which sort of drives up the ratio. So you have need-based aid, scholarship improvement, community college maintenance of effort, and technical colleges and equipment funding. Also, there's some tuition for technical education grants that have already gone out this year, and historically they had not quite gone out by this point, so it's sort of more of a timing issue that's going on with the Board of Regents. With the Kansas Commission on Veterans Affairs Office, the KCVAO is 15.7% below the average expenditure level, and that's primarily at the Kansas Soldiers Home. And the agency has indicated the facility has reduced FTE positions from 113 to about 90 over the past four years. Additionally, the agency this year has used a little bit of COVID monies to replace SGF, so that's also driven down a little bit further, but it's primarily that reduction in FTE positions. For the Kansas Department of Labor, it's 40.4% below the average. That's UI modernization. So that money obviously has not gone out yet. For the Department of Revenue, it's 10.9% below the estimate. The Department of Revenue is actually changing the way it does encumbrances. Historically, they had encumbered all their funds for non-salary and wage expenditures up front. And what they're trying to do is spread that out over the course of the fiscal year. The way it would work before is you would end up getting to the last quarter and you'd have to swap back and forth using journal vouchers. So they're just trying to reduce sort of the accounting amount of work that has to be done there. Fort Hays State University, they're about 19.7% above the average. We do believe that's an anomaly. And that's because FY 2018 was a particularly low year for SGF expenditures. So the new FY 2022 seems to be matching the FY 2019 levels. So we think we just had a bit of an anomaly in that data. For Kansas Neurological Institute, they're about 3.2% below average expenditure levels. That's not noticeable in itself. We did want to note that they have expended about 60.2% of their SGF funds. In speaking with the agency, they have indicated that is a choice that they make because Title 19 funding works as a reimbursement. Okay, well, that means that they like to spend their Title 19 funding afterwards and spend their SGF up front. And there has been a little bit of a pattern to see that. It just means that they've expended a lot of their state funds already. For the Sentencing Commission, they're about 27.8% below the average spending level. There was a substantial amount of SGF budget added there, particularly for the substance abuse treatment. And so those programs really haven't stood up yet fully. And so there's probably going to be some additional funds there. Parsons State Hospital is 17.5% below the average expenditure level. It's very similar where the Title 19 funding carryover from fiscal year 21 has allowed them to reduce some of their SGF expenditures. So they had some additional federal funding. It's allowing them to reduce expenditures in the current year. The State Fair Board is 42.5% above average spending level, and that's due to the exhaustion of special revenue funds with the previous closures of the State Fair. And KU is about 16.2% above average spending, and that is attributable to maintenance of effort funding and employee buyouts at the University of Kansas. So this is just a really quick update on where the agencies are relative to their approved budgets, and so how they're sort of moving through the money that they have at hand. With that, I would stand for questions.
All right, thank you, Dylan. Committee, any questions for Dylan? All right, you must have been very thorough because we don't have any questions. Thank you, Dylan.
Thank you very much, Mr. Chair.
We'll go ahead and turn it over to the last item that we had before we break for lunch, and that is going to be committee assistant compensation. So I'd ask the Director of Legislative Administrative Services, Tom Day, to committee. Welcome to committee.
Thank you, Mr. Chairman, members of the committee. I am Tom Day, Director of Legislative Services. I'm not sure I can keep you on schedule with a 1 minute like Dylan just did, but we'll try and get through this quickly. Mr. Chairman, members of the committee, each year the Legislative Coordinating Council approves all the temporary staff pay and pay ranges and the pay schedule, as well as the committee designations. In your packet that is in front of you, I have added the pay range, the temporary salary scale, the committee designations, and also at the very back is a comparison back to 2015, 2016 of what the legislature pays for committee assistants, office assistants, and just the different ranges. The temporary staff within the legislature comprises office assistants, committee assistants, doormen, document room, many employees. In a full year, we may have 190 to 200 temporary staff for the legislative session. The last 2 years, that has not been the case due to the pandemic as well. And so we've been running short of temporary staff for various reasons. And some of those reasons include the pandemic itself. And many of them are retirees who come to work for the legislature, and many of them stay for 20, 30 years. Many of them spend one session and then go on. The initial assigned pay scales are based on historic workloads. That's for office assistants and committee assistants, most generally, and oftentimes need modifications during the session. Following the LCC approval, we wait to see what the workloads of those schedules are. We assign all the committee assistants a specific pay range, but that can change throughout the session if the workload of that committee assistant increases during the session because of bills being in front of it. And I'll use the budget committee's the 7 budget committees as an example. A lot of times those never see a bill within their committee. They only see the presentations from the agencies, but oftentimes they may hear a bill. And 2 or 3 of those legislative budget committees have had extra action over the last 2 to 3 years based on bills that they may hear in front of them. The legislature, the LCC, has had a long-standing policy of paying no overtime. So we try to compensate those committee assistants and possibly office assistants who have additional workloads. We compensate them throughout the session with additional pay. So we may change their pay range, 1 or 2 pay ranges, depending on what that workload looks like. Like I said, attached to my testimony is the comparison of the salary that we've paid for the last 6, 7 years, as well as, if you'll turn to the back page, the first blue column shows the Department of Administration for the executive branch and the pay range. And we are above their pay range for similar jobs. The office assistant is the pay range 18. And then you get down to pay ranges 24 through 26, 27 are the committee assistants. And we may rotate the individual committee assistant between those pay ranges depending on their workload. So, Mr. Chairman, that's a brief summary of how we run the committee, the pay ranges. And if you have any questions, I would be more than happy to answer them.
All right, thank you, Tom. I do have a few questions. I know that you said this in your comments, that the Legislative Coordinating Council approves the pay raises or pay ranges.
Correct.
For the committee assistants. I'm just curious, the House Judiciary Committee Assistant is under range 25, yet the Senate Judiciary Committee Assistant is under range 26. Is there any particular reason why the House is in a different, they're not the same? Jill is nodding her head, yes.
Mr. Chair, I don't have a specific answer for that right at the moment. However, I do know that I believe it was last year we did have to move the House Judiciary up to the Senate Judiciary pay range. So it's just, it was set there at that particular range, and then we've moved it.
Okay. Jill?
So if I could remind everyone, several years ago, the House side split corrections and juvenile justice and judiciary. And so those, the Senate deals with all those issues. The Senate Judiciary Committee deals with corrections and juvenile justice issues, and the House does not. They're separate.
Okay, thank you. And then in regards to workload, you said sometimes there might be adjustments made, if I remember your remarks correctly. So I'm looking at K through 12 education budget. They're in range 20. And over the last few years, I would probably have to guess that that committee assistant has been extremely busy in regards to some of the discussions and the bills that have been coming out of that committee, as opposed to some of the other committees that are listed in 25 or 24. So what adjustments were made for that particular, if I could point out, K through 12 education budget committee assistant, what other compensatory things have been done for that particular committee assistant, since they probably had a much larger workload as opposed to maybe one that might be in range 24 or 25?
Mr. Chair, if I recall, for the last, definitely last session and possibly the session before, of course the session before was a shortened session, but in the 21 session, if I recall, we moved that committee assistant from a range 20 to a range 24 and possibly a 25 based on the workload the K through 12 education budget was going through at that time. And I did, prior to this meeting, just this morning, went through all 7 legislative budgets, budget committees, and not full appropriations, but the other 7 budget committees. And K through 12, social services, those 2 budget committees over the last 3 sessions had the most work done, but definitely K through 12 had 3 times the amount of work that even social services did. The others just generally may hear like I said earlier, may hear the proposals from the agencies, but not have a bill in front of them. And hearing a bill is a whole lot different aspect to the committee assistant workload because of the minutes that are included in that for the budget committee and everything else with the hearing of bills.
So for the Senate, were those same adjustments made when they didn't have the budget committees and then they kind of fell in like economic development and commerce not only had the standing committee work as itself, but they also had the budget work that was merged together this last legislative session?
This last legislative session, those adjustments were made for that particular committee assistant. Prior to that, they were just using a 3 to 4 person subcommittee that only had 1 hour to hear that particular agency in a lot of cases. Sometimes they may call them back for a second hearing, but in most instances, the senators, the individual senator who was appointed the chair of that subcommittee may also, that office assistant all of a sudden turns into somewhat of a committee assistant, but usually the committee assistant didn't show up for that budget subcommittee.
Right. Thank you. Committee, any questions for Tom? All right, seeing none. Thank you very much.
Thank you.
All right, we are just a little behind schedule. It's about 10 after 12, but we're going to go ahead and break for lunch, and we will return at 1:30 p.m. We're in recess. Representative Hoffman.
I move the passage of the minutes for October 8th.
All right, committee, you've heard the motion. There's a second by Representative Johnson. All those in favor say aye. Aye. Opposed? The minutes are passed. All right, we'll go ahead and move on to the next item on the agenda, which is the CAPERS request for proposal for legal services. So I'll turn over to Jill Walters, the first Assistant Revisor of Statutes of the Kansas Office Revisor of Statutes. Jill?
Good afternoon, Mr. Chairman and members of the committee. This topic might sound very familiar to you, and you might recall it because we saw a request for proposal from the Attorney General's office for legal services at the August 31st meeting. So the basic principles still apply because of the Professional Services Sunshine Act. When an agency requests or thinks they're going to need to hire an outside attorney, accountant, or other consultant for work that will be over $1 million, they're required to follow this process, which has the RFP come before Legislative Budget Committee. The only thing that's a little different about this one is because since it's CAPERS Legal Services, in the statute where it talks about the Director of Purchases, the CAPERS Board, those phrases apply to the CAPERS Board. So if you were reading those statutes and it said Director of Purchases, in this instance, you would want to refer to CAPERS. So, you know the process. They notify you, the state agency notifies Legislative Budget Committee that they are looking at these services, in this case, attorneys' services. They file the information with you, then per statute, Legislative Budget Committee has 30 days to hold a hearing and respond. So you were notified of this on November 16th and then had 30 days to hold a hearing or through December 16th. And I know CAPERS is here to then answer any questions because this is about a securities class action lawsuit. And so the specifics of the information of why they're hiring the attorneys, CAPERS would be best to answer those questions. But I will stand for questions concerning the statute and what you have before you.
All right, thank you,
process.
Jill. Committee, any questions for Jill? Senator Hawk.
Thank you, Mr. Chairman. I assume CAPERS pays for this, even though we give approval. It would not be a general fund obligation, just to be sure.
Jill?
I'm going to let them answer that question just to be sure we have the exact information.
Any other questions for Jill? All right, seeing none, thank you. And now I'll ask the Executive Director for CAPERS, Alan Conroy, possibly to answer Senator Hawk's question.
Very well. Good afternoon. Glad to be here. That's right. There's no general fund. In fact, CAPERS only would pay if the class action suit was successful and that there are earnings, then because of its the litigation, securities litigation setup, it's only if we or the class action prevails, then the attorneys get their proportionate share of those earnings. If it's not successful, then they don't get anything. And just, that's right, so CAPERS Board has a fiduciary responsibility, of course, to manage and take care of those assets. Of course, once in a while, $26 billion, sometimes in the public arena or even in the private arena there in terms of investments. Sometimes there can be federal and state securities law violations. Either a lot of the times it relates to failure to disclose certain informations. And since CAPERS would be invested in it automatically, then we would be a shareholder or be a part of that class action lawsuit, assuming, of course, we wanted to join in. And even though we do have securities litigation on a contract with them, again, we'd only pay if we would prevail. And second, these types of class action lawsuits, usually it's whichever entity has the largest share. So the likelihood that Capers would have the largest share against some publicly traded company is very remote. So it'd be the large, maybe the California retirement system or some of the New York, one of those large plans would be the lead plaintiffs in any lawsuit. And then we'd decide if we wanted to join, wouldn't pay anything. If they prevail, we'd get a proportional share. And just to kind of prove that, so the likelihood that we're going to be lead plaintiff is very, very small. And in fact, there in the testimony, we've not been the lead plaintiff in any class action lawsuit in the last 15 years and only twice in the last 25 years. Again, we don't pay anything unless the lawsuit's successful. But it would come out of the trust fund should there be anything, but those would just be sort of incidental expenses. So I just stop there, and certainly if you have any questions about the RFP, we've not, of course, done anything in terms of publishing the RFP until we hear in terms of any comments or direction that you might have.
All right, thank you, Director Conroy. Are there any questions for the Director? Representative Johnson.
Thank you, Mr. Chair. And is this just a general response that we are setting up? Is there anything that is pending?
Yeah, there's nothing pending. We'll go out for the RFP, we'll retain counsel, and then should something happen, usually it's like a 5-year contract. During that 5 years, then we'd already have counsel retained to assist us in that, but there's no pending or anticipated lawsuit at this point.
Thank you. Thank you, Mr. Chair.
Any other questions for the Executive Director? All right, see none. Thank you. Okay, we'll go ahead and move on to the next item on the agenda, and that is the League of Municipalities COVID-19 spending presentation. And so I would invite Eric Sartorius to the podium. Welcome to committee.
Hello, Mr. Chairman. Good afternoon, members of the committee. I am Eric Sartorius, Executive Director of League of Kansas Municipalities, part-time Christmas valet, here to join you all on this final week of work for some of us. So I'm going to give you a little background, talk a little bit about the background of the American Rescue Plan Act funds primarily, just barely touch on CARES Act, speak to some of the uses that we expect to see, give you a little outlook, and talk about the challenges. I did not do any written testimony. It's probably good. The contrast between white paper and my jacket would have really thrown you guys off. So jumping in here, as you recall, the Spark Committee designated approximately $400 million to go to counties from the CARES Act funds in 2020, with the encouragement that those go to cities and school districts as well. And I'll speak a little bit to that in the future. There was success in parts and less success in other areas. But the American Rescue Plan Act funding, it's technically the local fiscal recovery funds is the part that came to cities and counties. I'm just going to call it ARPA. I know there's a lot more out there, but almost $1 billion of that came to the state of Kansas for cities. Well, it went through the state of Kansas. It went through the Department of Administration as a required pass-through. They didn't have any judgment or options about who got it and who didn't, other than the city or county having to contact them. And actually, all counties got their money directly from Treasury, and any city over 50,000 in population went directly to Treasury. So it's the non-entitlement units, which is a complex federal way to say small cities under 50,000, went through the process of using a portal that the Department of Administration, the Office of Recovery designed to upload the required paperwork and everything to pass on to Treasury to then disperse those funds. And so counties got $566 million, larger cities $260 million, and the NEUs approximately $167 million. That's what has come to Kansas, and it's coming in two tranches. Half of that money has been received by the cities, counties that did apply, and the other half will come, I believe, next June will be dispersed. So the uses, and you've probably heard of these uses before, response to a public emergency, such as a pandemic, providing premium pay to certain employees under certain conditions, providing general government service if that government unit experienced a loss or reduction of revenues, and then investment in water, sewer, and broadband projects. And immediately, and just about once a month, I get a double check that that can't be for roads, right? No water, wastewater, broadband. Treasury did clarify that if there's a problem under the road and you have to fix that problem under the road, then you can pay for the road that you've destroyed. So I think some people will be choosing wisely what parts of the sewer need to get fixed first and fixing the road on top of that. So what have cities used it for so far? Mostly water and sewer projects. Some of those have actually tied in with cybersecurity, which is kind of an offshoot of approved uses. They've done some technological things, upgrades on security, upgrades on remote access to the system so that your wastewater person can access and check figures without driving out to the facility. I know Wichita is beginning to contemplate an affordable housing fund, and I also know several entities, cities and counties are using some of it as an emergency response, loading up again on PPE and swabs and testing and things like that. So then the natural question is, why has so little been done with that money over this period? And there are a couple of reasons for that. One, many of us are kind of encouraging them to go slowly. I know I've been preaching that to everybody because it's very easy when there's money that comes in and you see these 3 approved uses to shoot it right out the door. We have had some communities that have had a water tank fail or something like that, and this was perfect funding. But there is a huge amount of time, the end of 2024, to use the funds. And in fact, in some instances, you only have to encumber by then and have until 2026 to spend it. So keeping that long-term approach is one thing that we've cautioned. And then there's so many other programs between other ARPA programs, other funds that have come to the state, the infrastructure bill that's been recently passed, that a lot of cities right now are just trying to figure out how you can overlay and can you get more bang for your buck as you explore some of the programs. So for instance, USDA Rural Development had an emergency healthcare grant program, and you may have seen the SBA's shuttered venues operations grants that were distributed. I think Kansas had $46 million in that. So for cities, and I assume for counties as well, as you're contemplating the appropriate and viable uses for the funds, you also want to make sure that you're not about to spend very flexible ARPA funds on something such as a shuttered venue that has a specific pot of money dedicated to it. So we're trying to encourage them to keep their options open. The bipartisan infrastructure legislation has been a slow rollout. Rules and regs are still coming out and how the money will be distributed. Just last week, EPA kind of set the amount of funding that the state expects for clean water and safe drinking water funds and those revolving loan funds. So even with those, it's take your time. Some questions as to whether ARPA funds will be allowed to be used as matching funds for some of those programs and how else you can roll them in. The final piece that I would touch base on in terms of why there's some hesitancy or some waiting is there was an amendment added to one of the bills by the Senate, U.S. Senate, that would broaden the allowable uses of ARPA funding. So cities, again, are waiting to see that would open it up to things such as roads and other infrastructure, which is really the high focus for some of our cities. The successes that I would say to date have been that most cities did apply for ARPA funds. I know Secretary Burns-Wallace is scheduled to be next. I think there were only 25 out of the 625 cities in Kansas that did not apply for the funds. And those funds that were not applied were brought back into a pot and then redistributed out per the legislation, federal legislation, to the cities that were participating. Couple other pieces of pride, we're working with our national organization, National League of Cities, and U.S. Treasury to solve some places where funding got missed. In the original distribution, apparently Treasury doesn't deal with unified governments very well. It confuses them. So initially, unified government in Kansas City, Kansas got funds, but Bonner Springs, Edwardsville, and Lake Quivira were left off the list. So hundreds of thousands of dollars missing for them. We worked with NLC and worked with Treasury, got them added back onto the list. We were very excited about that. But while we were excited about that, we missed for a moment that they then turned their attention to the unified government of Greeley County and Tribune, and they took money away from Tribune. So we got back on the horn with NLC and Treasury and got their funding restored. And it is gratifying to see $125,000 added for them. And the final thing I touch on, we've had a good working relationship with the Office of Recovery. Their webinars are well attended by our members. Their Q&A sessions are a bit of a godsend because some of the questions that come my way, I can't give a great answer on, and either having recovery confirm that, yeah, that's a difficult question, or being able to provide some guidance has been useful. The challenges, I would say, going forward, over half our cities are under 500 in population, over 100 of them are under 100 in population. So it's intimidating when you get told you're going to have to file a report with the federal government. So we're working with them on the types of information to have. We're keeping them informed as to the processes to go along so that they're ready for their April report, and hoping the feds drop information and guidance more quickly on that. Initially, they were supposed to have reported on the October 31 deadline, and as of October 5th, the federal government had not opened the portal or created a user guide, so they pushed it to April. We're hoping that more like January they'll show something. Understanding the advantages and pitfalls of combining state and the ARPA funds, maybe state funds and other federal funds, is another area the cities and counties are going to be watching closely. Some of the suggestions I've seen are, can you segment your projects so you use ARPA funds for this part, you use some revolving loan funds for this part, you use some other federal one for this part, because what we've been instructed is if you commingle the ARPA funds, they then become responsible to the most strict guidance of any of the programs occurring. So some programs have Davis-Bacon it's been a long morning, apparently. Davis-Bacon funding and oh my gosh, wage requirements. But if you keep them separate, then you can do your ARPA funds not falling under Davis-Bacon, other parts may, and instances like that. So I think the only final thing I would say, and then stand for questions, we are very grateful that the federal legislation sent money directly to local units of government. The CARES Act funding was good in theory, but the instructions from the Spark Committee were essentially, it'd be great if you guys shared this money, but do as you wish. And so we had some places where things worked out really well. There might be a joint cities and counties and school district getting together on CARES funding. We had other places where they were given a list of things they could seek reimbursement for. They sought reimbursement and then were told, no, we're not going to reimburse you. I had one city that wouldn't let me contact the Office of Recovery and share some of their concerns because they were afraid of retribution from the county. And we had one instance where the county submitted a spending plan to the Office of Recovery as they were required to, and said that part of the plan was to provide about $18,000 in overtime funds to one of the cities in the county. That was approved. It came back to the county, and once it came back to the county told the city, actually, we're only going to give you $2,000. And when we had discussions with that with different agencies and organizations, it was kind of like, well, that's kind of a messy local issue, and we don't really want to do it. And the Spark guidance really just said, try and be good neighbors, and there's no guarantee of that. So we're happy with ARPA and think that it's a better path. So with that, Mr. Chairman, I'll answer any questions I can for you.
All right, thank you, Eric. And I would say, you know, you mentioned in your comments about how you're advising cities to not spend the money right now. I mean, try to find out exactly what their plan of action is going to be for that money, which they had the luxury of that with ARPA. We didn't have that with the CARES Act money.
Absolutely.
At the time, we didn't, because there was a deadline of the end of December in 2020 that money had to be out the door. Mm-hmm. So I think it gives cities a little bit more breathing room in trying to figure out what they can do. If a particular city, you said there are 25 cities that did not apply for the ARPA funds?
Correct.
Is that based off, I mean, how much they receive, is that based off of a ratio of how many people are in that city?
No, it was split, as it was assigned in a per capita basis, and I want to say that Kansas's funding worked out to about $151 per capita. I think there was only one city of significant size that turned down funding. Most of the others were cities, I would say, under 50 or under 40 in population. And some of them, between Office of Recovery and the League, there were still some cities we couldn't reach.
Okay, so you said 151 per capita, so that would be, like if you had a town of 100 people, you're talking about $15,000, which I could see why you wouldn't apply, because the paperwork would be more of a headache than what you're going to spend $15,000 on, which would be very little.
Yeah, it is. It's overwhelming, and in those cities, it's usually a city clerk. The ones that did take the money in those smaller places, even something as simple as being able to scope and check on the status of your sewer lines is a good, reasonable expense. And what we tried to share with smaller communities is, if you have those limited funds and you're only going to use them for one use, the paperwork should be pretty simple, because you aren't going to have a second party that you've sent funds to. It was city expended. But you're right, the paperwork requirements are things that definitely have some people on edge.
Okay. So was this open to obviously incorporated cities, but unincorporated as well if they wanted to, or?
No, sir. The federal legislation, since every state's a little different, there were some states where there are villages, for instance, and sometimes there are unincorporated places or townships. Townships means a very different thing here versus Connecticut, for instance. And so there was a set of criteria as to whether or not your other units of government needed to have money sent to them, and our townships didn't fall under that rubric.
Committee, any questions? Senator Billinger.
Thank you, Mr. Chairman, and thanks for being here today, Eric. I guess just two questions. You know, you mentioned on the sewer, like videoing or whatever. Are there limitations on what they can do? I guess it is at the size of your city, and like Chairman said, you know, 15,000, well, you can't put much for new sewer lines in, but how about water projects? I mean, is it strictly cities? Rural water doesn't qualify. Is that what you just said?
Yes, they could apply for other ARPA funds. I know with the infrastructure funding that's just passed, the revolving loan funds have got a pretty good infusion. I can't recall offhand whether that is something that counties could choose to send to a rural water district as a, you know, essentially a third-party vendor or a partner. I'd have to check more.
That was going to be my next question, is counties have these troughs of money, and can they do the rural type projects But I'd like to, if you can get that information, I'd like to know. Because I know I've had a few calls on the rural water and what might be available to help some of these folks, so thank you.
Yes, sir.
Senator Hawk.
Thank you, Mr. Chairman. On accountability, I think the Recovery Office did the accountability piece and reports were made for CARES Act. What's the accountability structure on this? Just directly with Treasury?
Directly with
For each
Treasury.
entity?
Yes, sir.
And the league doesn't have to accumulate any of
No, I'm sure we'll be answering a lot of questions, though.
Good. I think the state is happy.
I have no doubt.
Any other further questions for Eric? All right, seeing none. All right.
Thank
for
you
being
all.
here. Thank you for the update. I'll now turn it over to the Office of Recovery, where Secretary D'Angela Burns Wallace is going to be giving us a presentation on that particular department. Welcome to committee.
Good afternoon. If I can get out of this thing. All right. Good afternoon, committee. Just bringing you some updates. We have been a little busy, I think, since the last time that we saw you. So I have just one slide. It just has bullet points, and I'm just going to walk through a few things and talk through some of the material that we've shared out and some of the activity that has happened over the last couple of weeks. So I want to start by we'll walk through some of the projects, some of the meetings and activities during the Spark meetings, as well as some subsequent state finance councils. But one of the major movements in this space is that Spark brought on a project director, John Paralisi. And John should be online with us. John, are you there?
I'm here.
Yes, we can hear you. All right. John, I'm going to ask you to, if you would just introduce yourself to the committee.
Hi, I'm John Paralisi. Excited to be on board and to be working with all of you. I've been on board for all of 2 weeks now, so really been focused on getting the project plan from start to end completed, and excited to get underway at the start of the new year.
John, if you can stay with us for just a minute, my last bullet item is actually the Spark advisory panels, but with the chair's permission, I'm going to ask John to speak to that now, just because he actually gave an update this morning that I think would be helpful here as well. So John, do you mind sharing a similar update that you provided to Spark this morning around the work that you're doing to get the advisory panels stood up and your timelines and what you're thinking?
Sure. The big precedent we had before getting the panels moving was to understand what the overall integrated process plan was going to be. We're pretty close to having that complete. So the goal is going to be to get in motion with the advisory panels starting mid-January. And working with them through a process would probably be about 3 or 4 sessions per panel. Over the rest of January, February, and into March. And then having recommendations coming from those panels in the March timeframe up to the Spark Committee. And the Spark Committee would then be looking across the recommendations from all the advisory panels and developing a priority set. With the thought being that there would still be some interaction with the advisory panels after that. To either answer questions or to work on putting more details behind some of the areas that look to be high priority items from the Spark Committee.
Thank you, John. I don't know if you want to take any questions directly about the advisory committees to John or his plans around them at this time.
Do any of you have any questions in regards to the advisory panels? Nope. Senator Hawk.
Welcome aboard, Director John. About what time of day do you think those panels will occur, since we have some legislators that are on those panels?
At this point, we can be pretty flexible. I need to meet, talk with the leads of each one of the panels, and I think we could have total flexibility around that.
I would assume it'd be up to the discretion of the chairperson of those different advisory panels.
Mm-hmm.
So yours would be at like 2:30.
That's a really good time for me, actually.
Yeah.
Any other further questions? All right, Secretary?
Wonderful. John, you are welcome to stay on as I walk through, and thank you for providing that update. All righty. So since, just a couple of updates. One, you all have heard about the hospital employee retention program, the nurses frontline staff. Just a quick updates. Since the last time we were with you all, again, all of the awards are out. All of the 118 that applied have received their dollars. We are also starting to collect the data, the metrics, the reporting metrics that were required for the hospitals. We have actually provided those files directly to KLRD as well. So if anybody has interest in just seeing the numbers, there's various data points that were requested for Spark as this process went through. And so we've also have copies of their various policies on vaccination, testing, quarantine, and the hospitals are required to keep those updated. And so all of that data is starting to come in, and we are circulating that information. So that program is well underway. Just wanted to, we're seeing somebody's email. I was like, there we go. And so just so that you all are aware, again, if you all have interest in some of the data around the number of beds, the number of nurses, how much turnover they're having, those are some of the data points that were requested. And again, we've provided that file to KLRD. And then as that gets updated monthly, they're due the 15th of every month for the previous month's data, we will provide a fresh file. So if you do have questions there, let us know. Or again, that data is available through them. Moving on to our next set of items. Spark met on, or actually the Spark made a recommendation to the State Finance Council to move forward dollars for the continuation of testing. And I think I saw you all kind of right in the middle of this. Spark had already met, but State Finance Council had not met at that time. Since then, State Finance Council has met. They approved $14.9 million of CRF dollars that have been recouped to help cover and support testing through December 31. You'll see subsequently there was an additional request to help support continuation of that testing through the first quarter, and that's the $27.1 million. A couple of your background documents that you have just to kind of help give some context in the testing space. There is the memo that Spark utilized in relationship to the request, and it just outlines kind of the overview. It reads at the top of that particular document, proposal to extend funding for COVID testing contracts through March 2022. So that's just the background document, or the document that Spark used as a part of their conversations. It gives you description, budget request, rationale, and allowability. The other thing that we provided to Spark, and you all should have a copy of or has been sent to your staff, is the testing backgrounder. We mentioned this at one point in time earlier when I was with you, wanted to make sure you all got a copy of it. And it walks back through the varying testing dollars that have been received, the contracts, how the testing dollars have moved throughout. This was prepared for Spark in particular in relationship to their conversations, but wanted to share it here as well to continue to provide that context. Subsequently, Spark also, when we met on December 10th, besides the continuation of funding for testing, we also entertained a proposal for the 24/7 state employee pay plan. I believe that was on your agenda earlier today, and so you all received a deep dive into that plan. And the recommendation from Spark went forward for up to $30.3 million to be able to support that 24/7 pay plan for FY '22. State Finance Council did meet last Friday, and they moved forward and approved the funding for both of those recommendations, the continuation of the testing, as well as the 24/7 pay plan. This morning, Spark met again. So as I said, we've been a little bit busy. And this morning's conversation, yes, thank you. So there were a couple of agenda items this morning. Copies of proposals from this morning. Apologies, because we just met this morning. It's not listed here, but we did meet this morning. There were two agenda items from this morning. One was an administrative item to, at the request of K-Board to, for their funding authority, their spend authority for their Gear 2 dollars, which was a continuation of Gear 1 that came out of CRF and HB 133. And then the other agenda item was a group of proposals, which was titled Round 1 Proposals for Spark. We will get this circulated, but because we met this morning, it wasn't a part of the original packet that we sent. The proposal was for $154 million. It had three components to it: economic revitalization, health and education, and connectivity, and had projects in each of these areas. The economic revitalization was an economic development infrastructure initiative that invests and supports to specific building developments, modernization of business park facilities, and other infrastructure developments, and the attraction and retention of businesses in Kansas, subject to allowability. That was for $100 million. In health and education, there was an individual education learning loss grants, directing grants of $1,000 per child to families to purchase materials to offset learning loss. Purchases could include education materials, computer software, tutoring services, etc., focused on low-income families. And the connectivity item was a Kansas Connect and Learn initiative. The learning loss grants were at $50 million, and then the Kansas Connect and Learn initiative, which are matching funds for school districts to use alongside the FCC's E-rate program to invest in high-speed broadband build-out, was for $4 million. That slate of $154 million of these three initiatives was approved this morning with a lively discussion. So if you're tracking on where we are right now, and originally Spark had agreed to allocate up to $500 million by December 31, including what was approved this morning. The total Spark by the end of the 2021 calendar year is $261 million. So it is the $154 million from this morning, $50 million from the nursing retention program, $27 million for the extension of the testing, and $30 million for the 24/7 pay plan. With that, I stand for questions.
All right, thank you, Madam Secretary. So the $154 million, that'll be going before the State Finance Council?
It will. It is a recommendation out of Spark, and it will go before State Finance Council, correct?
Okay. Committee, any questions for the Secretary? Senator Bellinger.
Thank you, Mr. Chairman. Thank you for being here today, Madam Secretary. I guess my question is on the child care. How do people get these funds? How do you disperse them? And how do you decide who gets them and who doesn't get them? And I mean, how does that work? I mean, we're talking a lot of money for child care, and I just kind of like to know how and when.
So the individual learning loss grants, it's not specifically childcare. So the design of it is that these are where families would receive $1,000 per child, and they can be used for resources to help with learning loss. So it can be materials, it can be books, it can be software, hardware. There would be identified a set of allowable items. We have a couple of states that have our peer states that we've been following and tracking and working with to see, because they've rolled out similar programs. So you create an opportunity for eligible families to apply, and then they are put into what you would call, say, like a platform that gives them the various areas that are allowable for their expenses. And this includes local, it's a variation of vendors, but you also can use for services and things of that nature. And so it is actually a wide array of items allowing for the family to be able to identify the things that best fit their students in terms of increasing their learning. It is designed to be an impact low-income family, so there is an eligibility requirement that, as we've seen other states have modeled, that includes a tax verification step that identifies that a family is eligible, and then from there you move through from lowest income, doing first come first served basis in terms of making the dollars available. All of this comes into how which we call program design, to make sure that that information is clear on how to access, what's allowable, and creating a portal or a platform that allows it to be easily accessible and clear on what things are eligible to the families and an easy way for them to access them. Both Idaho and Oklahoma have similar programs that they've launched recently, or actually have been stood up for a little bit longer and are having really good returns and success with them.
Okay, so this money is coming out of education or out of childcare?
This money is coming out of the non-discretionary funds for ARPA, and the priority area is called health and education. Remember, we had 4 priority buckets, and so this is in the health and education bucket.
Okay, so this is out of the $881 million in education.
No, this money is coming out of the discretionary dollars from ARPA. This is the 1.6 million.
I believe Senator Bellinger is referring to page 3 of the testimony that we have supplied, where there was $350 million allocated for childcare, but nothing, is that what you're referring to? Okay.
Yeah.
But nothing has been recorded? So as of, it says allocated to date, 350 million. But it looks like, I mean, there's no side notes to that, or.
So if you're looking at the backgrounder, this is this document, yes.
Figure 2 updated ARPA allocations.
Yes, this is the non-discretionary dollars that came direct in to agencies and entities. And so under this education bucket, you would flip back.
And I'm not really asking about the education, I'm asking about childcare.
On page 3.
The $350 million in childcare.
Right, so you're talking about something completely different than I was talking about just here.
Yes.
I just wanted to make sure that I'm tracking. So if we're switching from the Spark discussion and that learning loss to this chart, in this is the non-discretionary dollars of the, let's see, under your blue, you're going to flip back to, if you turn to page 5, the $350 million that have come in under child care, under the non-discretionary ARPA, they have come in two buckets. One is under the Child Care Stabilization Grants, and the other one is under the Child Care and Development Block Grants. Do you see those? That is where that 350, how that has come into the state.
You
on
said
page 5.
Page 5?
Mm-hmm.
Maybe I'm on the wrong sheet, evidently.
Yes, Amy.
Mr. Chairman, with the Secretary's permission, I might note on page 3, the funds that the Secretary was talking about for the learning loss would not be under the blue category. I believe she's indicating they would be under the gold category towards the bottom, the $1.6 billion. So that money she's talking about from Spark recommendation this morning is not under the blue, it's under the gold band here at the bottom.
Thank you. I'm not asking about that.
Right,
I'm not asking about.
You're asking about the blue.
I'm asking about the $350 million that goes into childcare.
Yes, sir.
How do you determine who gets it? Does Tom's wife get it? She runs a little daycare in her house, and how does she apply?
No, sir. So the $350 million come into pre-existing grant programs that are already there for the state that have their parameters. One of them is the Child Care Stabilization Grant. The other is the Child Care Development Block Grant. These are both, I believe, administered, I want to say by DCF, but I will double check where they're currently administered. And they have guidelines that identify how that happens and how you apply. But these are pre-existing, like these are programs that existed before, and there are new dollars that are coming into them.
And that's fine. I'm just asking you. Tom's wife runs a daycare and out of his house. Does he qualify? Where do they go? I mean, these people ask me this kind of stuff. I said, well, heck, I don't know. I'll ask.
So what we will do is we can provide you the background on these two programs and their eligibility from the agency that runs these programs specifically.
Right. I just, $350 million seems like a lot of money for childcare. Maybe it's not, but I just wonder, I mean, are these Tom's wife, or is it a business that someone else has, in a commercial building and they have 5 or 6 people working there? I don't know. How do you determine who gets it and how do you apply? I mean, this is information that people ask me, and if you can't even tell me, it's no wonder they can't.
Well, what I would say, sir, is that because these are administered by a particular state agency, that state agency can explain the details of their particular program. I come and provide you all a high-level overview. Please understand that part of my job is to try to make sure we have a sense of everything that's going on. So I have to say that, no, I don't have the specific level of detail for an individual program, but as always, I commit that we will provide that information to you.
Thank you.
So if we look at, starting on page 5, and we have a breakdown of the non-discretionary funds, which directly went into state agencies to be dispersed out. And then we have, like going back to the child care, I don't want to go back to that, but I mean, we have the child care stabilization, and there it has what the money can be used for. And 90% of it, of the 214 million, can go for that. So that is more, are both of those buckets for child care providers, or is one for those that might be like parents that can apply and get reimbursed back for tuition? Or is that, because I'm kind of reading it both ways on the 133 million.
For the child care and development block grants? Yes. Is that the one you're asking about? So I think that there's a couple of different categories underneath that, but let us pull the direct information and provide that to you. Because again, this is a pre-existing program, and so it has parameters, and the agency can provide the specifics on it. One of the things that this document was trying to do is, as kind of a more high-level backgrounder, was earlier in the conversation, we had shown a chart that showed kind of those big buckets of non-discretionary dollars, and one of the questions was kind of, well, what's in those buckets? So we tried to do simple descriptions just to give you a sense of what those are, but in these particular cases, we can provide that deep dive into the specifics of the individual program. And if there are others in here that you all have a question around, we can pull those as well.
Okay. So when we talk about the discretionary dollars that the state has received, which is going to be dispersed, discussed with the advisory panels, approved by the executive committee for Spark. I guess, talking about the different advisory panels that we have, what are the specifics of what the money can be used for? I know we've talked about this before, but it seems like it almost changes as time moves along. And obviously, we're not going to be meeting until mid-January, according to John, for the most part. And there might be more changes that might derive until then. But it just seems like sometimes the money can be used for anything, and then it has to be more specific. And then, so can you kind of explain what the end goal is going to be with the advisory panels, and then what's finally going to be approved by Spark, and then what the ultimate approval is going to come from the State Finance Council?
So I will start, and then I will actually ask John to share, because he's been doing a lot of kind of pulling together and thinking about how the pieces come together overall. So what I would say is that the allowability parameters have not changed. We are still under an interim final rule. However, we don't have the final. So some of those really broad categories of what's allowable and what is not haven't changed. But with each program, initiative, or conversation, there becomes caveats. And the more and more we work with the money, we start to find those and try to identify those guardrails as we move through. One of the things that I know as we start with the advisory panels, and John can maybe speak a little bit more to this, it'll be a combination of both getting a background and understanding of allowability, eligibility, things that we have seen as best practices and needs in a particular area, as well as a more by sector, like analysis of that particular area, where some of the priorities are that have already been raised, gap analysis, as well as, in conjunction with all of that, as well as what are other dollars that might leverage into a particular area, right? So whether it's non-discretionary dollars, where there's other federal dollars, but also having that advisory group have a good sense of, are these, the discretionary dollars, the best dollars for some of the priorities that you all will be looking at? So trying to paint that larger picture as the group delves into identifying priority areas, identifying projects, and being able to then bring forward, say, like a slate of projects that then the executive committee can take a look at in a more holistic way across all of the advisory groups. So the advisory groups will be looking kind of a deep dive into their areas, but then allowing Spark, the executive committee, to have more of a more holistic picture before they start making decisions across various areas and priorities. John, do you want to add a little bit about some of what you talked about this morning, a little bit more about that process or how you're thinking about it?
I think you outlined it pretty well. It's going to be a situation assessment going into the process for each one of the advisory panels. Information around not only kind of where the money can be spent or what restrictions there are, although I think it'd be fair to say there are not quite as many restrictions in this case, and the guidance was to really think about this in terms of things that could contribute to the long-term revitalization of the state. So there'll be a lot of flexibility. The Spark Committee, as well as kind of the advice that had come in federally, was don't focus as much on things that could create kind of long-term budget impacts. Look at things that could be more catalytic investments, where with a one-time investment, you could make a big difference over the long term. So I think it'd be fair to say that this is probably the chance to be pretty creative without as many restrictions in terms of things being necessarily earmarked as has happened in the past, although some conditions will exist.
All right, thank you. Senator Hawk.
Thank you, Mr. Chairman. Just in case my wife is listening in, that was an example from Senator Bellinger. We are not starting a child care. We're barely able to keep up with the grandkids, and we're trying to get our fitness in before Christmas. So thank you. But I appreciate it being a good example. Back to the thing that Spark talked about most recently in terms of the three areas. Is this proposal one that has been approved, the 154 million in economic revitalization, health and education, and connectivity. Is this what was approved by Spark already?
Sorry, my apologies. This morning, Spark approved the recommendation to go to State Finance Council.
But hasn't
So
been approved by state.
it has not been approved or heard by State Finance Council. We literally met at like 10 o'clock this morning.
So my question then may be premature, but I don't know what on the health and education portfolio, what I understand the low-income families, and I think this is a good idea to work with those children through their families on their learning loss that many of them probably had during the pandemic. I wonder how they're going to get the $1,000, and I see some other states have figured out how to do that online in a marketplace and pre-approved vendors, so that may take care of a concern. I could see a family with 5 kids might get a $5,000 check, and I wondered how we would account for that going. I'll let you answer that later, but the other area I wondered about was what is a qualified census tracts?
Yes. So the first part is that the way the program works, it's not a check out the door as much as qualifying and then being able to spend those dollars through that marketplace. And again, that helps with management. It helps with allowability, ensuring that the families can get quick access, but it also helps to ensure that it's being utilized on the things that are allowable under the design of the program.
So the vendor where they purchase the materials or services would keep track. That they wouldn't even really have a credit card or any other kind of thing.
Not direct, but they would have like those resources, like say in the portal. And it's more of a platform which has multiple vendors. So even an entity like a Staples, or if you're familiar with Scholastic, where you can order books from, a couple of the states have Scholastic as one of the vendors that's in the portal, right? So there'll be multiple types of entities in the portal, but then you can also set it up that an individual can use them and they could submit receipts for particular eligible services. So it might be around tutoring, educational services, things of that nature. So there would be, again, the dollar amount is available. There would be a way for that family to be able to access that dollar amount and then use it with authorized vendors and or for authorized eligible related types of expenses.
Will there be, either through the school district or some other resource, someone who could advise a family what might be appropriate for their youngster?
So I would say that that is not necessarily a design that's directly tied to this program.
I could see how that might be helpful. Back to the qualified census tracts.
Yep. So, and I can get you all the exact definition. Qualified census tract is something that's actually specifically identified in allowability and eligibility guidelines under ARPA, and they are, make sure I have the right language. It's a definition that we will provide, and so it is, it's like a census tract with poverty rates of at least 25% or in which 50% or more of the households have low incomes below 60% AMI, right? So it's a particular category that the federal government identifies in, there are actual identified census tract, qualified census tracts that are identified within the Kansas area. So we can provide a written definition of the qualified census tracts as well as those that qualify within Kansas.
So I'm assuming some of those might be geographic poverty areas?
Yes.
Okay. Thank you. Thank you, Mr.
I guess to kind of going off of Senator Hawk's question, so if a family applies for this grant, what is the matrix to gauge whether it was successful or not? And the money was, well spent?
So I think part of what the program is after the design of the program is trying to ensure that we can get immediate resources into the hands, into the household in combination with various programs that school districts are already putting in place also with learning loss. So as we do that program design, what we'll be looking for is, of course, the level of participation we'll be tracking on and looking at where their utilization is, and paralleling that with if we're seeing any changes or differences. But the reality of what part of this is a bit of what I would call more of that recovery or that response in being able to get dollars to parents to be able to get immediate resources like hardware. They also can pay for, say, like internet services, software, books, ebooks, things that they know that they can use readily and immediately available to help in that learning loss.
All right, thank you. Representative Wolfmore.
Thank you, Mr. Chair. On the learning loss and the vendor, who decides, or how does the list of vendors get approved? How does that all work?
So that's two different, thinking about it in two different ways. There are a handful of entities that are currently have the ability to create the nature of the larger platform, and our peer states are using those entities in that way. So that's one vendor in this conversation. What you're, I think, maybe asking about are kind of the broader different resources. And both in the models that we've looked at, there's like a true wide array of known, like, kind of as I said, like a Staples type, Office Depot, Scholastic, but then there are others or direct buys where you can get to various things. And so what we would be looking at when we look at more that vendor platform is who would be able to provide the most and the best to be able to meet the resources for our needs and for our citizens. And that will be something that we would consider in selecting the larger vendor, like how many vendors, what types of vendors, the depth and breadth that become available through their portal, making it easier and more diverse in what people could access. Okay. Does that help?
Yes, it does.
Okay.
Thank you. Thank you, Mr. Chair.
Committee, any questions for the Secretary? Senator Hawk.
Thank you, Mr. Chairman. I very much appreciate the summary. When we look at the resources that have been made available for our state's recovery and coping with the pandemic, and you always do a great job kind of keeping us up to date with what's coming in and what's going out. So one other question I have on this figure 2 is, what are the capital projects fund? Has that been spent, and what kinds of things has that gone to? Is that some of the connectivity internet build out that we've had in the past?
It is, and actually on page 15 it talks about it. So it's called the Capital Projects Fund, but in the original bill, it was actually very tightly written. So it's not as if you could just like throw various projects in there. It had a very strong lean towards investment for high-quality broadband infrastructure, connectivity infrastructure, devices and equipment, as well as it created a caveat for critical projects that directly enabled work, education, health, and monitoring. So it was, while it says Capital Projects Fund, it was kind of tightly narrowed. And so these dollars again came in with the specificity, and this is being leveraged into the our broadband, the broadband work, as you mentioned. Yes.
Great. Thank you. Thank you, Mr. Chairman.
Any other further questions? Senator Bellinger.
Thank you, Mr. Chairman. That sparked a question. Do you use this broadband? Is that just all fiber and that type stuff, or how about these low base satellites like Hughes and some of these are coming out with? Are we looking at any of that stuff, or are we just strictly, looking at fiber and that type stuff?
So my understanding is that we are looking at a number of different things, fiber being one of it, but also kind of other areas. I actually would encourage, we can get information from the Office of Broadband because they've been working on planning, working with stakeholders, identifying that larger strategy around the state's broadband. And while fiber is a big component of it, it's not the only component, because there are other pieces for investment and opportunities for innovation and looking at what else can be done in our spaces. But they would probably be the best to give you an idea of what that larger plan looks like, what some of their areas around what they're seeing and hearing from their stakeholders, so we can reach out to them to share some of the work that they've been doing in that space.
Thank you.
All right, any other questions? See none? Thank you, Secretary, for being here.
Have a wonderful holiday.
You too. All right, now we'll go ahead and move on to the next item on the agenda, which is performance-based budgeting. And so I would invite to the podium Dylan Deere, the Managing Fiscal Analyst from the Kansas Legislative Research Department. Dylan?
Thank you, Mr. Chairman. I've spoken to you quite a bit about performance-based budgeting in the past. I'm not going to rehash the things that we've talked about previously. I just wanted to make you aware of the materials that are available. During the previous 2021 legislative session, there was a request by House Appropriations to provide updated performance-based budgets. There was a template that was sort of put together, and we worked with the Division of Budget to sort of finalize that template into a format that all the agencies could go ahead and fill out. So it incorporates a little bit of expenditure data, as well as incorporating the performance measures. Some of them are broken down by program. Other ones are broken down by sub-program. There's a roughly 600-page document that is now available on the KLRD website for each agency. Every single agency has turned in a performance budget at this point, and you can access individual briefs as well through the same functionality that you would pull down subcommittee reports or individual briefs for budget analyses. That's been incorporated into our website. So we have representatives from a variety of the functions of government that are here and ready to talk to you about the performance budgets which they submitted. And unless someone has a question, I would turn it over to them. You'll probably recognize the first person who will be speaking.
I think we will too. Any questions for Dylan? All right, seeing none, thank you, Dylan. And that individual is David Fye, who is now the Executive Director of the Behavioral Sciences Regulatory Board. So welcome to me, David.
Thank you, Mr. Chairman, members of the committee. My name is David Fye. I'm the Executive Director of the Kansas Behavioral Sciences Regulatory Board, and I appreciate the opportunity to come before you today and speak a little bit to our performance-based budget, specifically the performance measures that we had asked to have highlighted when we submitted our budget. You should have two documents from me. One is just a two-page narrative explanation that goes into a little bit of background framing our performance-based budget narrative, and then we have another document which basically just has a series of tables, and I'll kind of explain those two. But excited to come before you. We are also known as the BSRB, and we license most of the state's mental health professionals. We license individuals with 7 unique professions, and there are different tiers of licensure for most of those professions. To put some context for our performance-based budget, we are a small agency. We consist of 9 full-time employees, and we have 1 full-time investigator who handles most of the investigations and discipline, another one who splits time between investigations and licensing, but the majority of the staff focuses on licensing of applicants. We have a budget under $1 million each year. We receive no money from the state general fund or federal funding. Most of our revenue comes through licensure fees, and we collect that into our one fund, the BSRB fee fund. So when looking at our program, we've decided to go ahead and split out our expenditures and our different elements between 2 different sub-programs. There is a licensing program. It also covers renewals of licensure. And then we have a second sub-program that deals with investigations and discipline. We were asked to provide information, specifically the different programs or sub-programs, the statutory basis for each program, the consequence of not funding each program, the program history, some program goals, and a certain number of measures, including output measures, outcome measures, and also some cost efficiency measures. And you should see those on the sheet that has most of the tables. Just to preface some of those details on the page, this is an exciting time for the BSRB. I came on board with the agency at the end of last year, so I've been with the agency now for about a year as executive director. And during that time, it's been the unusual circumstances of the pandemic, which have been a challenge for our agency, just like they've been for some of the other agencies. Part of that is we've been under a directive to have a lot of staff work remotely. And so that has affected how we process licenses and using different technology to do so. But we've also adapted and used different technology like YouTube to broadcast meetings, and we've tried to find efficiencies by less in-state travel and different things like that. So if you could direct your attention to the page that has the licensing and renewal program with the tables, what we decided to focus on for these that were highlighted for the legislature, one of the main measures that we look at is the number of applications that we process. And currently, right now, we process most of our renewals through our system that's on our website, but our initial applications are currently mostly paper. And so as a way to move towards an electronic processing of applications, we have currently moved our payment for those to an online payment portal on the BSRB website. But as you'll see on the page in front of you, you'll see how many of those new applications are reviewed within about 30 days. You'll see how many of the renewals are reviewed within the 30 days. And then we showed you the number of licenses that have been issued each year, and then the number of renewals each year. Concerning a cost efficiency measure, I can tell you that that is one area that we are looking to improve in terms of our metrics. Right now, being a small agency, a lot of our costs are shared evenly between the different programs. So with 9 staff members, if we have something like rent or a copy machine, we may try to allocate those expenditures as planned expenditures by trying to divide it by how many staff members work on each side. But when we pay the bill, we pay it once. So what you see reflected as the cost per license renewed is actual expenditures, or in the case of fiscal year 22 and 23 planned expenditures, divided by the number of renewals to give you some idea of the cost per renewal. On the second page, the investigation and discipline. We do regulate the different practitioners under the board, and we receive complaints against practitioners. We refer to those as reports of alleged violations because they have to tie back to the statutes and regulations governing the profession. So what we provided to you were some program goals that largely focus on how quickly our investigators are able to process those report of alleged violations, the amount of time it takes to go ahead and collect all information, draft the reports, and provide that to a subset of board members known as the Complaint Review Committee for their chance to go ahead and review that information and provide direction to us. And then similar to what we did with the licensing program, we have the amount of cost per report of alleged violation through a rough calculation of actual expenditures or planned expenditures divided by the number of reports of alleged violations that were reviewed. Now, one thing that you may see that's a little interesting here is if you look at the bottom of each of the pages, you will see that funding differs greatly if you look back at past years. And that is because we plan expenditures and try to allocate expenditures, but I believe in the past there was some difficulty actually splitting out these expenditures when those payments were made. So we are working on keeping track of that on even greater level in the future, but we wanted to provide a little look back on 5 years, given the 2 other budget years, 22 and 23, so you would have some basis. And I believe as we move forward in future years, you'll have even more detail to look at these numbers. But that's what the current numbers appear as right now, using the actual expenditures that were reflected at the end of the year in the SMART system. If you look at the overall agency by combining both, then you would have the total amount of the budget if you look at it that way. But, Mr. Chairman, I wanted to go ahead and just briefly touch upon some of the performance measures that we submitted and why the numbers appear like this before you. We are currently looking at other improvements, and we're really excited about that, but wanted to give you a snapshot of what we had looked at and examined when we turned in our budget back in September. So I'm happy to answer any questions on our performance measures in front of you or plans for the future.
All right, thank you, David. Committee, any questions for David? Not seen any. Thank you very much.
Thank you, Mr.
Senator Hawk, I spoke too soon.
Sorry. Thank you, David. You may not know this, but will other agencies similar to BSRB, such as the nursing board, have similar performance measurements based on these two areas, both licensure and discipline? Or is this just something that is unique to BSRB in terms of how you tackled performance issues?
Mr. Chairman, I believe there's some discretion about how agencies chose to split these out. We chose to split it out by the two different subprograms. If other agencies have more than one program or more than one subprogram, they may have broken it out that way too. But I do know they're going to be providing information for you a little bit later today, so I might defer to them to speak to their performance measures.
And my question may be more appropriate for Dylan, but.
Dylan, do you have an answer? And actually, I have a question for you too, Dylan.
Senator Hawk, so David is correct. There is a great deal of discretion in how they're organized. However, all of the regulatory or fee board agencies were often encouraged to sort of break down along very similar lines because there's a natural cleavage along these types of regulatory agencies about their enforcement arm and their sort of licensing arms. And so where that division was possible, they were encouraged to do so.
And one of the reasons I would ask that is sometimes us as policymakers might get some insights in terms of what's the efficient use of budget dollars, comparing if it costs BSRB $768 per violation to review, but the nursing profession can do that for $350, then that may raise an interesting question of, do they have some tools, or what is the difference between those? But if they had different areas that they were looking at, we wouldn't be able to make those kinds of observations and to ask those kinds of difficult questions to put the director on the spot.
Certainly, I would agree.
All right, the question I have, and I should ask this when you were up here before, Dylan, but when we go back to appropriations and Ways and Means committees when session starts back up, how are these going to be embedded in the budget books that we're going to have supplied for all the members of the committee?
Certainly. So there will be a selection of these measures, okay, which will be identified with an asterisk inside of our budget analysis. So at the program level, you'll see some of these measures. There are way too many. For example, for the Department of Commerce, I think I have 72 pages worth of measures for evaluating that particular agency. So you will receive the full document. So we'll pass out a copy of this document along with our budget analysis, but there will be a selection of KPIDs or key performance indicators that will be included along with the budget analysis. And we will also be incorporating those that the Division of Budget has selected to incorporate into their governor's budget recommendation as well. So you'll see what the governor determined was most important, those additional ones which we said, we think these are valuable measures to be reviewed, but you'll also have the full gamut if you want to dive into it a little bit deeper.
Okay, thank you. Representative Hoffman.
Thank you, Mr. Chairman. On the, I see it'd be page 131, the investigation discipline. So under the funding, there wasn't anything in 19 and so quite a bit less in 18. Is that just trying to look back that far back? It's just a challenge?
Mr. Chairman, and that was partially due to a process recording when those expenditures actually were made. And so basically what had been occurring the last few years is that there were planned expenditures. So when the budget was turned in, they would try to apportion certain costs. So if 20% of the agency was investigation discipline, they would say, well, rent cost really should be 20% of that rent cost under this program and 80% under that. But when the actual bills were paid, it really was just paid from one source and it was just recorded. And as the licensing was the primary subprogram, a lot of those just went under licensing. So from those past years, almost all the expenditures were just under the licensing program. But we've been trying to split more and more of those out so you can have more transparency for the actual differences between the programs. Mr. Chairman, could I comment briefly on the report of alleged violation question?
Yes, you may.
One thing that I would mention is that, as I commented earlier, there are 7 unique professions, and the reports of alleged violation also have a broad range of how long one might take to work on than another. For example, there could be a continuing education violation where someone's short on hours, and that one might just take a quick check to review, whereas you might have another where someone is alleged to have an inappropriate relationship with someone that they've been providing services to. So there's a thorough investigation to collect information from multiple parties. Sometimes records of practitioners are reviewed and different things like that. So we did our best to take the total cost based on salary of the investigators and other things we could attribute to that. But looking at it per report of alleged violation is not perhaps a perfect measure, but it was a starting point, so we could kind of divide those out based on how many they reviewed.
All right, any other questions? All right, seeing none. Thank you, David.
Thank you, Mr. Chairman.
And now we'll go ahead and move on to the Kansas Department of Agriculture, which I believe we have 2 individuals here, Kellen and Kelsey. Is that right? Welcome to committee.
Well, good afternoon, Chair Waymaster and members of the committee. We actually enjoyed the exercise to go back through all of our performance metrics. It's my understanding that the Kansas Department of Agriculture is one of the first agencies that undertook a deep dive in this over 5 years ago for both performance-based budget metrics as well as a zero-based budget look into our budget. So it was a great time to review and go back to these and take a look at them. We do have 5 separate programs within KDA. So as Dylan pointed out, there was some discretion, so you will actually see 15 separate performance-based budget metrics for each of the separate programs. And so instead of licensing and regulation or things of that nature, we actually completed a separate one for each of our programs because we have very separate and unique programs within the auspices of the Department of Agriculture. So we are a little bit larger than the Behavioral Sciences Regulatory Board with over 300 employees. Certainly not the largest agency that will stand before you today, but instead of going through all of the pages of this and pointing out things, it's my understanding that the pages were just handed out to you. But I would take the time to let you kind of review that and go through some of these with you. Administrative services is very administrative heavy on the things that's going to be legal, HR, things of that nature that we do for the agency. Following that, you'll get all of our regulatory pieces of the agency that fall under agribusiness services. So you'll have dairy and feed safety, food safety and lodging, grain warehouse, lab, meat and poultry, pesticide and fertilizer, plant protection, and weights and measures. We also include ag marketing, animal health, the Division of Animal Health, conservation, or the Division of Conservation, and then our Division of Water Resources. So you'll see water appropriations, water management, and water structures. So if you guys would like to take the time to just kind of peruse over those, see if anything pops off the page at you, both myself and Deputy Secretary Olson would be happy to answer any of those questions for you, either now or to get those answers back to you for the committee at the appropriate time.
Okay, we'll just take a look at this, but I think Representative Hoffman does have a question.
Wonderful.
Thank you, Mr. Chairman. And this may be for Dylan as much as, so looking through this, it looks like that almost every one of them have basically said everything's mandatory. And except I see administration is discretionary, but there's got to be a little bit more of in some of these agencies that's discretionary than just what they're. Is there no other things that you do that you feel like are discretionary outside of this?
I can answer how we answered it from the
Okay,
KDA
yeah.
perspective, and then the longer I can keep dialing up here, the better it is for me.
That's fine.
From the KDA perspective, we answered it that if there was a state statute that required us to either inspect a licensee or for a license holder to hold a license or something of that nature, that we answered it as that it was a mandatory or that it had a statutory basis. The only program within KDA that doesn't have a statutory or a mandatory basis in which to exist is administrative services. So we put discretionary, however, it would be a little difficult for KDA to function without a Secretary of Agriculture or any of those other support services, though those could possibly be done in another fashion.
Sure.
However, we did not get, as Dylan said, there was some levity there, and so I guess I would also invite Dylan if he has a different answer to that on how to answer that.
You don't mind?
Dylan?
There was very few situations in which they were marked discretionary throughout this process. Anytime there was a reference to a statute of any sort, and even in many cases it was the general authorizing statute for the agency, the program was labeled as mandatory. I would note that most of the authorizing statutes are pretty general, but they do provide a responsibility to do a certain thing, which is, so I understand where agencies are coming from as far as that being a mandatory requirement. But you are correct, that was marked discretionary on very rare occasions.
Okay, so I might have a few questions, and then I'll turn it over to Senator Hawk. If I'm looking at ag marketing, and obviously the fiscal year 2021, 20, and 19 are the actual numbers. And then I'm sorry, I'm on from the land of Kansas, item number 3 on marketing.
Okay.
And to get to fiscal year 2022 and 2023, did you just take an average of those 3 years, or how did it come with, in fiscal year 2022, there's going to be 17 more memberships from the land of Kansas?
So my understanding is that during the pandemic, there was a great push for local and consumer-driven local foods and things of that nature. And so we have seen an uptick in memberships in that program. And so an increase in from the land of Kansas membership, they are expecting that number will go up with locally produced producers marketing meat and other products of that with the From the Land of Kansas logo. How they selected that exact number, I could certainly ask that program and get that answer back to you.
Okay, and that kind of answers the next question I had in regards to the total amount of sales generated from the land of Kansas. Obviously, in fiscal year 2021, there was a pretty big increase. I mean, 2020 and 2021, there was a big increase from 2019, about 7, and that's in thousands?
That is in thousands of dollars.
Right. And then on the next question I have under animal health, kind of set some pretty high standards of having a 100% performance measure. Like number 1, respond to foreign animal disease investigation requests within a 4-hour time frame, and you're going to have 100%. So is there no room for error?
While I think that is a quite lofty goal, I think that's one that we hold ourselves to be quite accountable for. Because if we don't have 100% of those performed in a fairly short time frame, there is quite an opportunity for things to happen there. So the program has been very successful in completing all FAD or foreign animal disease investigations within that time frame in the past, and they feel that it's appropriate to complete those within that time frame going forward.
Okay, there could be something that occurs where that 4-hour time window won't be met. I just don't want you to miss your goal.
No, we appreciate that, but that's a very important piece of our ag economy.
Okay, Senator Hawk.
Thank you, Mr. Chairman. I recently attended KDA simulation exercise on foot and mouth. And I think they were certainly meeting those goals and maybe doing better than that, and applaud them for that. My question is more one, this may be a dial-in question ultimately too, but I wanted to check and see if my recollection fit what you kind of led into with your presentation, Kellen, that performance measures seem to me to have been part of the culture in terms of the budgeting process at KDA. And my recollection, sorry, there goes my, I don't know how to turn off my ring, but anyway, probably that child care thing we're setting up that I didn't know about that Rick did. So anyway, in the budget presentations for the KDA budget, it seemed like in addition to the budget packet we got, you always had a performance assessment section in that budget, and we're very thorough about that, and this seems that you've even gone further with that. Is that a correct assessment from my observations over the years?
Very astute observation. Very astute. No, when we started the process about 5 years ago, we broke each of the programs into decision packages. We combined performance-based budgeting with zero-based budgeting and created a matrix of decision packages. So like I said, this was the opportunity to take those and put them back together and provide the best information that we could in this. We're still putting it back into a matrix or a spreadsheet that was provided by KLRD or DOB, but we appreciate the opportunity to provide the input in that format that it was requested.
Good, thank you. Thank you, Mr. Chairman.
Representative Hoffman.
Thank you, Mr. Chairman. So, yeah, that was when I was the chairman of budget, Ag Budget, and we worked on this, and Ag was definitely the guinea pig, I guess, and but they've done very well with it. So through this process, did you find areas that you felt like did it help you to find areas that you maybe needed to put more time into, less time into, more money into, less money into by going over this again?
You're certainly going to make me squeak as a guinea pig if you're asking me that question. It was very helpful, not only because of the back and forth with the programs, but within the agency and with the support of Secretary Beam and Deputy Secretary Olson, we turned it into a conversation. So we provided the programs with the opportunity to submit things, and then throughout the budget process to come back for that continued conversation. And I think those program managers did find the opportunity to find cost savings, to look at things a different way, to really look at the outcomes and the outputs and ensure that they were looking at them differently. That doesn't mean that there's not always the opportunity to take things in a different direction or to look at things in a different light. But I think it was a positive experience, and I do look forward to utilizing some of the things in the process in the future.
Representative Johnson.
Thank you, Mr. Chair, and Representative Hoffman actually had the meat of the question that I had, so thank you for the information. But I wondered if there was any particular thing that jumped out from that, and I'll have a question on a specific area that I just noticed, although I haven't gone deep in anything, but was there anything that you all really learned that jumped off the page at you that happens to be top of mind?
The thing that just jumps off the page to me is performance-based budgeting can be incredibly valuable. And what KLRD and DOB did is an incredibly useful exercise. It's when it becomes full circle with the DOB, and we're trying to bring that back, that we're ensuring that our accounting numbers, when we're doing the actuals or the GL piece of it, that we're also including the accounting piece as part of that conversation. Because some agencies, their budget analysts or their budget directors don't also serve as their CFOs. In some places they do. But I think that's a continued conversation that could be had to strengthen that, because that's not always a holistic picture that's looked at. that when you go and you look at those numbers and you come back, we can say how we've budgeted it, that we did that as the performance-based piece. But just like behavioral sciences said before, they budgeted for something one way, but then when they went to pay it in the past, it wasn't done that way. Probably, I mean, they do a wonderful job. So, but that's something that I think we all took a look at. And while we think we do an excellent job, we can always learn from.
So thank you for being one of the guinea pigs to help us learn more from that process. Just to go into one specific thing, and I agree, the goal, even above getting our arms around everything where this is really helpful, is the outcomes. How does that drive that to be better for everybody across the state? On page 13 in the grain warehouse section, it looks like in fiscal year 2021 on line 3, we fell to a little lower part in our annual examinations. And I see long-term, our goal is to get again back to 100%, which may be right, may be the right goal for that, maybe some of these. And as I tie that together, I look then to the bottom line that is there on the funding, which is shifted by a column, but 2021 was the low of funding, which probably relates to why we were at 78%. And what is the trade-off in value in terms of hours, value added to everybody to get to that 100% measure, and the cost? How are those brought together for us in the report, or are they? Are we given the measures and then we've got to try and take it another level?
A little extrapolation there, possibly. I don't think the extrapolation is quite on the page. In grain warehouse, they were down 1, if not possibly 2 examiners during part of that year. So that's why the funding source, the actuals in that year, they didn't have, they're very salary and wage heavy because they're going out to do those grain warehouse examinations. If they didn't have somebody in that role to complete those examinations, they weren't paying out those salaries and wages. However, we worked very diligently, the industry worked very diligently. We did some changes last year in legislative session that's going to increase us in the future and moving forward. And so with some modifications going forward, I feel that it's practical to have these increased examinations completed with some of those legislative changes we had, as well as being fully staffed, because they have been able to fill at least one of those positions, and we're hopeful that they'll be fully staffed here shortly.
So thank you. And with that and the changes in industry, I wondered if those were instructive to us to continue to evaluate what we need to do to have the right level of those inspections to make sure that everything is operating safely or as we need it to, or if that is also a variable that changes over time as potentially the industry players consolidate or whatever the world may be changing with us.
I don't know that I have the correct answer to that today, but I think the industry would always be happy to weigh into that, and we'd be happy to partake in that conversation going forward.
Representative Wolfmore.
Thank you, Mr. Chair. I don't know if this is a question for you or Dylan. So I remember when this whole scenario came up in appropriations last year, and it seems like the answer was, but correct me, we were already doing performance-based budgeting, but this is just a new way of reporting it, so it's more useful to us as appropriations committee members. Is that correct?
That's my understanding, is that they put it in a standardized format with a couple more guardrails provided.
Okay.
Dylan, and I was going to just kind of elaborate. I believe Dylan had also explained to us last session that technically when the budgets are submitted, these are, or the performance measures are in there. It's just in the book, sometimes they just get, I don't want to say lost, but they're just not included.
Certainly, agencies submit an additional narrative, a very large document, and that has a lot of these measures in it. In addition to the measures, the things like specific program goals, there are a program goals section, but there's a lot more detail in these documents than you're seeing. The program histories, the consequences of not funding the program, the specific statutes that are the statutory basis for the programs. None of that materials are necessarily included, although they sometimes are inside of a DA 400, but it's not universal. Additionally, the distinguishing between output and outcome measures, okay, and the direct incorporation of the expenditures for that particular program. I mean, it's all just sort of tied together. The other thing you're going to see in these documents that individuals are encouraged to is comparing, these are the actual expenditures from the submitted budgets from the agency request. So if there are enhancements and stuff like that that would cause maybe those FY22 or FY23 outcomes to increase, you'll be able to see those reflected in those measures there as well. So I mean, it's just tying everything together in one location with a little bit more data.
That's what my perception was. I just wanted to make sure. Thank you very much. Thank you, Mr. Chair.
All right, any other further questions for the Department of Agriculture? See none, thank you. We'll now move on to the Kansas Board of Nursing. I believe the Executive Administrator is here, Carol Moreland. Welcome to committee.
Thank you very much. Good afternoon, Chairman and committee members. I'm Carol Moreland. I'm the Administrator for the Kansas State Board of Nursing. And I was asked to come and just kind of discuss with you our performance-based budget that I submitted. Just kind of to recap a couple of things for you before I go into that. We are governed by an 11-member board that's comprised of 8 nurses, 3 public members. Our agency consists of 27 FTEs. And the mission of the Board of Nursing is to assure the citizens of Kansas that they're safe and competent practice by nurses and mental health technicians. We actually have the statutory authority to regulate the practice of nursing, mental health technology, and advanced nursing practice. So how I did our performance-based budget, you'll actually see it's in 4 different areas, okay? Because if you look at the regulation that we do, it's broken down by licensure, it's broken down by education, and under education, are the education nursing programs that lead to, pre-licensure and then advanced practice. And then it also includes the continuing nursing education because we do require 30 hours of continuing nursing education every 2 years for all of our licensees. And then we have part of our role of regulators is to investigate any possible violations that we may receive from complaints, something along that line. And then also to discipline any violators who have violated the Nurse Practice Act. So that's why you'll see it's broken down into licensure, education, investigation, and discipline. And that's why I chose those. Just to kind of tell you a little, probably people think of licensure as the biggest thing that we do, and we do a lot of licensure. At the end of fiscal year 21, we had over 79,000 licensees with the Board of Nursing. So we issue licenses by different license types, like initial, and those might be your graduates who are coming out of a nursing program. They've graduated, they want to get licensed for the first time. Licensure by endorsement, that would be if someone's licensed in another state and maybe they're coming to Kansas now and they want a Kansas license. Licensure by reinstatement, this would be licensees who for some reason have let their current license lapse. Maybe they had children, they didn't think they were going to practice again, so they just let it lapse. And now their kids, we see this a lot. Their kids are in school, they've got some time on their hands, so they want to start back and be a nurse again. So they have to reinstate their nursing license. And so just kind of unlicensure renewal, that's the other one, because all of our licensees have to renew every 2 years. It's by their birthday month, and it's an even or odd year based on whether they were born in an even or odd year. So we have licensees renewing all the time. It's not once a year or something like that. So, we, like all of the agencies, it has been very challenging during the pandemic. Everybody wants nurses, and we understand that, definitely. One thing that has been in our favor, and I can only say a big thank you to the legislature for this, is they approved the Nurse Licensure Compact in 2018, and we implemented it in 2019. And I will tell you that has made all the difference in the world with being able to move nurses from one state to another, because basically there's 38 states in the nurse licensure compact. If a nurse has a license, a multi-state license from one of those other states, they can come into Kansas and work, and they don't have to do anything with us. So it's been very easy for especially like the big employers who have maybe hospitals across several states, to be able to move their workforce based on where they need them. So it has been extremely helpful. That in and of itself kind of impacted us a little bit, and we knew that. We did. I will just tell you the biggest impact, we knew we would not see the full impact of the nurse licensure compact until we had been in it for 2 years because of our 2-year renewal cycle. And then one thing that really complicated it a little bit more for us was the extension that kept being put on about the licensure expiration dates. Basically, somebody whose license was supposed to expire March 2020, they actually were given, with all the extensions and everything, until August 28th of 2021. So we didn't see the full impact like we thought we would after 2 years. It was actually more than 2 years, and that's the reason why. But just to kind of tell you an impact that that had, now you have to put this all in perspective. We actually lost over 6,000 nurses renewing their nursing license. Now just hear this out, please. It was appropriate that they did not do that, because they had multi-state licenses from other states in the compact. So it's not that they can't practice in Kansas. Please understand that. It's just that we lost the number of licensees, and we knew we would. We knew that going into it. But when people hear that number, they get a little concerned that because everybody needs nurses, right? So we made it so that we don't have as many nurses in Kansas. That's not true. We probably have more nurses that can come into Kansas and practice now than we've had in the past because of 38 states being in the compact. So a big thank you to the legislature for passing that when you did. That was extremely helpful to us. So you will see, if you look at the licensure one, the program goals, we've heard very, very loud that everyone wants these nurses licensed as fast as possible. And that includes us. We want to get them licensed as fast as possible. So, you know, you have to look at what would be reasonable. We have 4 FTEs for this number of licensees. And we're very automated. Our license area has been very automated for a number of years. So that maybe is where we're in favor of maybe some other boards that are not as far along as being automated. But we really felt like it was reasonable that we would issue these within 3 business days of having all of the required information. That is the key there. It's not the date that they submit the application. It's the date that we have all of the required documentation. And sometimes that's the problem. They will submit half of what they need to, and then they kind of forget that they need to submit fingerprints for a criminal background check. Well, we really can't do anything until we have those fingerprints. And so you will see by our performance outcomes and everything, I broke them down by type of licensees because the different types of licensees have a little bit more work involved with them. Like reinstatements have a lot more work. Renewals are really much faster to do. So you will see that I kind of broke them down by that, but you will see we hit 100% most of the time. And actually, I will tell you that we probably get them licensed, if at all possible, the very same day that we find out that we have all of the information or that they've passed the licensure exam, something along that line. So licensing staff, I think, does a very good job there. You know, some people ask about the outcome that we have. The percentage of licensure application information is entered accurately into the licensing software. If the information in there is not accurate, they may get a nursing license that their name's not spelled right, or they don't have the right name on it or something. Okay, an employer isn't going to like that when they check to see if they have a nursing license. If they do this online, they enter all of the information themselves. But we still take a few paper applications. Probably, I would bet 95% of our applications are done online. Especially, we're seeing more and more graduates because they're younger. They don't know paper like the rest of us do. They know computers, sitting down in front of computers and doing it that way. So that's been really, I think, a very good thing. But, so that's kind of licensing. And then education, just to kind of tell you about education, we have over 50 nursing programs in the state of Kansas. And so we have to get an annual report from those nursing programs every year. And they have to, we have to do site visits to them, but that's not every year. That can be anywhere from every 5 years to every 8 or 10 years. It kind of depends. But I have one FTE that does that. So she's very busy on the road a lot. But the annual report tells us a lot of information about what happened that last year in that nursing program. So we just want to make sure that we get annual reports from everybody. And then we have almost 100 long-term C&E providers that we actually regulate also. Again, they submit an annual report, and they have to renew their application like every 5 years, so we want to make sure that we stay current on that. So that's why you'll see some of the program goals there. And then investigations. I will just share with you that investigations was the division of our agency that probably struggled the most when we went remote because everything that they did was paper. And within, 2 days, we said, okay, we got to get you out of here. And they have done, I will say, a tremendous job with all the change that's been asked of them. They do have a lot of stuff electronic now. It's not exactly where we want it to be, but we've come a long ways. And so you'll see that some of the indicators are probably down a little bit. We've changed some of the processes even further to get the numbers up and make it better. But it's very important when we get complaints in that we review them in a very timely manner. We want to make sure that if there's a complaint in there from perhaps a nurse that should not be practicing nursing, maybe there's been physical abuse of a patient, something along that line, we want to make sure that we can get that nurse so they're not doing that to anybody else. So we need to look at it in a timely manner. We also want to be able to offer up help to our licensees who perhaps have problems with substance abuse. It's no surprise if you've listened to the news, the pandemic has had a very big toll on nurses. And so we're seeing a lot more mental health. And unfortunately, some of them turn to substance abuse for that. We have a nurse assistance program that we want to be able to offer to them to get them into it. Our board would like to rehab the nurses instead of just taking their nursing license away, if at all possible. So if we can get them into the nurse assistance program as soon as possible, get them some help, and hopefully then they'll be able to turn it around and continue to be a nurse in the state of Kansas. So that's why we do that. What we also do, that is probably all from complaints, but we also review on our applications if they have any legal history. Okay, so that is also called an investigation, but the investigation like that is not going to have the time involved that it would have perhaps for a physical abuse situation, drug diversion situation, something like that would take more time. So you will see that the investigations, there's different types of investigations and they take different time to complete those and stuff like that. And then of course we have discipline. We have two disciplinary counsel, their assistant AG, And after our board reviews the results of the investigation, then our board decides whether there's been violations of the Nurse Practice Act. If there's been violations, then they are sent over to our disciplinary council so that they can start to work with the nurse and figure out what needs to be done and stuff like that. That's kind of how I broke it down. I don't know how the other licensing agencies have done that, but that's why I broke it down the way I did, is we basically have the 4 divisions. And then what I did with administration and information technology is we cover all of those 4 areas. So that cost was just divided among the 4. And that's kind of how I figured that. So I don't know if you have questions or.
Yeah, I think we do have a few questions. On, under education, on item number 4, it said percentage of continuing nursing education providers submitting a 5-year renewal application as per their schedule. Why is that there's nothing in 2019?
Number 5?
4.
4, I'm sorry. I was looking at 5 and I'm like, yeah, I have that. Because we did not really track it then. Okay, when I started this, some of these we did not track back in 2019, so I didn't go all the way back there to try to pull that data together. I mean, I guess I could have, but that would have taken a little bit of time.
I was just kind of wondering whether there was no number there.
Yeah.
Representative Hoffman.
Thank you, Mr. Chairman. On the investigation, I think this might be a typo, but maybe not. It's good. On number 3, under the outcomes, on 2023, are we really pulling down the cost per investigation from $496 to $40? It should be $400 maybe, or?
Yeah, it should be.
Okay, well, I mean, it'd be good if you were able to do that, but
you know, you can look at this so many
No,
times
that's
and
fine.
you think you've caught everything.
No, that's fine. I just was, I
No,
was curious.
thank you
So the other thing is the number of investigations opened. So it looks like you had, over the last 3 years, it was about 1,300, but it looks like over the next 2 years, you're figuring about half that. What was happening in 19 and 20 that didn't happen in 21 and that you feel like is better going forward, I guess?
Sure. And that, we really looked at that. To be real truthful, I'm not sure that some of how this was figured in the past was exactly as accurate as we're figuring it now. I shared with you that we didn't have any of this stuff really electronic. Okay, we have a licensure software database that is really great, and it has an enforcement piece to it that we have never purchased. And the enforcement piece would actually track all of this much better than we do. We have actually tracked it on Excel sheets or Access sheets or something like that. Then we have an employee who leaves, we fill the position with somebody else, okay, they don't start doing it exactly the same way. And so furthermore, our data is probably not quite as good as it should be. Now, we've actually put that enforcement module in our fiscal year 22 budget so that we can purchase that, so that hopefully this will be tied together a little bit. In the past, we haven't separated investigations by complaints and applications. We did that because, again, they don't take the same amount of time. They really do not. And so we felt like it would be helpful to maybe separate those, and that way, going forward, it'd be able to track a little bit. We've had a lot of changes in the investigative area. We had two long-term investigators who retired. It has not been easy to refill those positions. We really cannot match the private sector as far as the pay, and so we've tried to capitalize on other things that perhaps would make them want to work for the state. And we have been able to fill 2 of the positions with, I think, very, very competent people. But there's been a lot of changes in this area. So I don't know if I answered your question.
Yeah, no, you did. Thank you. Appreciate it. So going back to the number of licensees, I was glad to hear you explain that because it looked like we were down like almost 9,000. So are we higher than the other states to, I mean, because that's going to impact your budget after a while.
Sure.
If they can continue to, say, license themselves in Missouri instead of in Kansas. So are we competitive as far as our licensing rates, or is
it really
strict?
depends. Missouri has like double we do, but they have St. Louis, they have Kansas City, okay? We have Kansas City on our side and we have Wichita, but they don't compare with those 2. They just absolutely do not as far as size and everything. So we will never compete with Missouri. They've got like double that we do. I will just tell you what our board did when they implemented the nurse licensure compact, and this has been a really saving grace to our agency, is they looked at our licensure fees, which had not been raised for quite a number of years. And we looked at all the other 50 states in the nation, and we were 3rd from the bottom as far as the cost of our licensee, their fees, because we're a fee-funded agency. So that's what makes us survive. So our board really looked at it, and they did increase some of the fees, and we're about halfway between the other 50 states right now. And at first, I will tell you, there maybe was a little concern from the nurses, but when we explained it, because we actually, when we went into the compact, we had our national organization kind of pull some numbers for us and help us to try to figure out how was this going to impact our budget, because we knew it was going to. We did. And it was estimated that we would probably lose about $500,000 a year. We could not really afford that at that point. So that's when our board really looked at, okay, if we raise our licensure fees a little bit, we don't want to be the top in the nation. Definitely not. And, the licensees, some of them at first said, this shouldn't be raised and stuff. But when we explained, do you still want all the services that you have now? And they're like, well, of course. And we're like, okay, it's estimated that we're going to lose about this much. A lot of our licensees don't realize that we're a fee-funded agency. They think we get our funds from the state general fund. So when we tell them, no, that's not it at all. In fact, we give $100,000 to the state general fund. They're like, oh, okay. So actually, I think they've been pretty okay with it. We are probably comparable to Oklahoma as far as the number of licensees. Probably Colorado too, Nebraska, yeah, but not Missouri. We'll never compete.
The number of licensees wasn't my point. It was the amount that we're charging, because we would rather they licensed in Kansas than somewhere else. And so my point was whether or not the amount that we're charging them is comparable in that 38 state, so that we're not pushing them to another state to license because it's cheaper. So that was my point.
Right. And actually, just to let you know, they don't have a choice as to what state they get licensed in. If they're going for a multi-state license, it has to be in their state of residence. So that makes a big difference. Because they have to show us, are they a resident of Kansas? And that wasn't our choice. That's part of the rules of the Nurse Licensure Compact. And so every one of those 38 states has to do the same thing. So like take, for example, Georgia. If there's a nurse that used to live in Georgia and she moves to Kansas, okay, she can continue to practice on that Georgia multi-state license until she has submitted all this stuff with us and we change it over to a Kansas multi-state license, okay? So it's not that they have to wait and they cannot work. That's not the case at all. They can come, it just has to be in their state of residence. Does that make more sense?
Yeah, no, I knew they didn't, but then why are you down? I guess I'm not, if they They still have to buy a license in Kansas?
No, we're
Okay.
down because, say that we had somebody who had a license in Kansas, and their license was, I'm trying to think this in my head so I can think this through. They actually renewed their license in, say, September of 2019, okay? But they live in Missouri. But we were not part of the compact at that point. So now they live in Missouri, so they have to keep their multi-state in Missouri, so they would give up their Kansas license. There's no reason to keep it.
Okay. All
Yeah,
right,
does that
makes
make sense?
Yeah, it does.
Okay.
I appreciate it. Thank you,
Yeah.
Mr. Chairman.
All right, committee, any other questions for Carol? All right.
All right, thank you.
Thank you for being here. The next individual that we have is from the Department of Children and Families, so the Chief Financial Officer, Dan Lewis. Welcome to committee.
Thank you, Chairman, members of the committee. My name's Dan Levine. I think there was a typo on the agenda. It's close. And I am the Chief Financial Officer for DCF. I see they're handing out that yellow packet. I also had some testimony. I tried to summarize it. Yeah, great. We have a lot of performance measures. We've been working on our performance-based budget since House Bill 2739 passed back in 2016. Have made several iterations and continue to update it constantly. It's been a positive process for us. It's required us to look at all of our programs and sub-programs and redesign those, putting everything into areas with common objectives and similar work, and we've done that. The PBB also required programs and sub-programs to be ranked. You had asked earlier, you know, what we've learned or challenges. That was one big challenge when you ask program directors or an agency to rank everything we do, you know, from number one down. I think a lot of directors would say everything we do is important. So that was a challenge that we were able to do. So on our testimony, if you look at page 3, that first table there shows our ranking. We have 9 programs in DCF. 6 of the programs have performance measures. The other 3 are administrative type programs. And under those 9 programs, we have 59 sub-programs, of which 44 are non-administrative and have outcomes. So on that first table, it shows each program, each sub-program ranked, and then the amount of expenditures associated to those. And then later I'll show you that every one of those has at least one performance outcome or output measure. So for example, our number 1 program is client service delivery. These are the direct client contacts, all the 1,600 staff that are out in the 36 service centers that we keep. So in that program of those 1,600 staff, we have 6 sub-programs, 5 of them, which have performance measures, 1 which is administration. So our number 1 program is the Child, Adult, and Protective Services field staff. That's about 750 staff that investigate child and adult abuse and neglect. Under that would be our eligibility staff, another 700 that determine eligibility for all of our assistance programs. Under that, the employment staff, et cetera, going down there. So that shows our number 1 ranked program. Number 2 then is our prevention and protection services, which is our child welfare program. That has several programs under it. The first one being the Protection Report Center, which takes all the calls around the state. We have 3 protection report centers, 1 in Topeka, 1 in Wichita, and 1 in Kansas City, which take all the reports, do the screening, and assign them out. Our second program would be foster care, which is all the grants and child placing agencies and all that. One of our biggest programs, you can see it's $265 million per year. So I can go down there, but that ranks all the sub-programs in our prevention and protection services. That continues on to the next page. We have an Economic and Employment Services Division, which provides mostly assistance to low-income families. Secretary Burns-Wallace, when she was up here before, she was talking about the child care assistance. There was a question of the child care stabilization funds and such. Those come to DCF, and those are in this program here. You can see the second one down is our child care assistance. The fourth one down, child care stabilization, which that child care stabilization is most of that COVID money. So that's money that came directly to DCF, addition to the normal funding we get to provide additional services. Some of it was enhanced child care for like our HEROES program, which provided child care to medical professionals and emergency professionals. So that money that she was talking about, you can see it lined out in the Economic and Employment Service sub-programs. We also have a Child Support Services program. It only has one sub-program because everything they do is similar. They establish paternity and collect the child support. That's a $32 million program and our fourth ranked program. We have the Rehabilitation Services Program, which has 8 sub-programs under it, provides employment services to individuals with disabilities. And then the Developmental Disability Council, which is an independent council with a board of directors, and we just provide administrative support to them. The other 3 programs we have are administrative, just to support those 6 programs above. So that table kind of prioritizes and shows the dollars related to all of our programs. Starting on page 5, those would show the outcome and output measures within the budget. This is a summary of the 95 outcomes and outputs, and these would be the same 95 that are in that yellow packet that Dylan passed out, just a summary of those. Each one of those programs has at least one outcome, and if I'm going to skip by that table right now, if you go to page 9 of our testimony, that's where we provide some key performance indicators. Most of these indicators are ones that were selected by the DOB and the governor's office and us back when we started this. And so to stay consistent, I've included most of those in this. So for each one of those, you can kind of see what the program is. The first one's Prevention and Protection Services, the sub-program, Protection Report Center, and then the performance measure for that would be the % of initial assessments completed timely. So when we get an allegation comes in over the phone or a fax, sometimes email, we have until the next half working day to make an initial assessment and an assignment on that. So this measures the timeliness of that. We experienced a large decline in timely assistance timely assessment between 2017 and 2018, and then it started to increase again in 2019. A lot of this had to do with we had a lot of turnover. We had senior and key staff who left. During that time, intakes had missing information, which caused them to be untimely and had backlogs. We provided a lot of training. Over those years, we budgeted additional funds in this area so that we could provide zero shrinkage and started trying to recruit to keep these positions 100% filled. And starting in 20 and up to 21, we were able to get back to the high 90% outcome on this. So that's kind of an example of one that we had issues with, and by tracking it and coming up with some different measures, trying to improve it and keep it high in future years. The testimony, if you go to page 10, I provide a few more. That's one on our foster care program. One of our outcomes that we use is the percent of children who reach permanency within 12 months of entering foster care. This is a federal AFCARS reporting requirement that we have to report out to meet 4E. It's also real important for children to move out of foster care quickly. The general trend in this one is down. It should be up. And this is one that we've been working on to improve. And there's a Deputy Secretary Keys will be talking tomorrow about the foster care program and about this issue here. The third one I listed is also a foster care outcome. Percent of children in out-of-home placements less than 12 months with 2 or fewer placements. And this one trended down a bit from 16 to 18 and then has started to go up and improve greatly. This was one from the lawsuit, the McIntyre lawsuit that's being tracked. So I included that one in here. On to the next page. This one's on family preservation services. This is one that we don't have as much data on. It's a newer performance measure, but I included it here. It's families referred shall not have a child removed into foster care during the service period or within 30 days after closure. This measures if then family pres was effective in preventing removals. We just have 2 years of actuals. It trended down a little from 20 to 21, and we're hoping to, we're working with grantees and hoping to improve that. We budgeted 91.4 and 92.6 in the out years as we increase that. The bottom of page 11, that one has to do with child care assistance. The employed families receiving child care assistance whose earnings increase in the next review period. This is another one that decreased from 2016 to 2019. We've seen a big increase in 2019 or in 2020, and this is because COVID caseloads fell from 9,800 in March to 7,700 in April, and those that kept their jobs had higher incomes. So I think that was mostly an anomaly when child care caseloads fell so severely during 20. And 2021, it's picked up and started to increase along the trend line, and in 22, we're seeing it increase too. So that was the first child care. On page 12, is a TANF employment services outcome, that the percent of TANF recipients obtaining employment. This increased from 2019 to 2020 and then decreased in 2021. The fiscal year 21 decline reflects a downturn in the job market. 2022 to date, we've seen this increase back up, and we will work to continue to have that one go up. Number 7 is a similar one on TANF employment. It's the percent of TANF recipients who retain employment in the quarter following. The job retention among the former TANF clients has declined, with more employed adults exiting TANF over time. The remaining clients are harder to serve. For example, in 2016, we had 5,363 people. In 2021, that's down to 3,494, and half of those are exempt from employment, meaning that they're child cases. So this one's one with a much smaller population that we've had a challenge maintaining the outcome measure, but we continue to work on that. On page 13, there's a couple on the child support administration, the percent of current child support collected. The current child support collected shows a steady rise. The fiscal year 20 is a one-time increase that was a result of economic stimulus payments, and there's some economic stimulus in 21 also, and it's starting to return to the normal increasing trend. The one under that is the percent of cases paying on support arrears. That one has a big fiscal year 20 increase also, and that's because a lot of those arrears payments were qualified for debt set-off, and the stimulus money was captured for the children. On to page 14, we have vocational rehabilitation outcome, the number of Kansans with disabilities achieving competitive integrated employment. After a dip in 2017, employment's increased through 2020. 2021, there's a sharp decrease. We associate that with COVID. There were a lot of people that we weren't able to employ during that. 2022, to date, we've seen that rebound. The one under that is client service delivery, the economic and employment field services staff, the percent of EES applications processed timely. This is a customer service outcome, which we feel is important. For most years, timely applications have been above 95%. In fiscal year 18 was a transition we made to KEYS, a new information system. There were a couple of weeks of bugs and backlogs. This was kind of expected. It was pre-approved through the feds in advance, and once those worked out, it had a result on our 18 numbers, but they went back up to where they had been in 19. And the final one that I provided on page 15 has to do with our disability determination services. These are staff that review Social Security disability claims. It's the percent of DDS claims processed accurately. The measure also centers on customer service, like the prior. This one's been pretty consistent, above 97%, which is above the national average, and we budget to keep it there or improve it slightly. So I tried to provide just 12 or so. Like I said, we have the packet that they passed out. You'll see there's 90-some of them in there. These are kind of an example of 12 of those.
All right, thank you. Dan, right? Just
Dan,
the last
yes.
name was wrong.
Just the last name.
Okay, I will make sure. Committee, any questions for Dan? Not seeing any.
All right, thank you.
Senator Bellinger, never mind. Oh, got one.
Thank you, Mr. Chairman. Thank you for being here, Dan. And maybe you can answer this, and if you can't, I notice we've got on the sheet tomorrow morning the foster care presentation. So,
Yeah.
you know, I just want to know how many children are in foster care. Do you have that number?
I do. It's 6850, I think, was me. I don't, we ended last year at 6850. I don't know what it is. It changes every day. We have been trending down the last couple years, and in consensus caseload, we expect it to continue to go down, but it's right in the 6,800.
So 6,850.
Yeah.
Yeah, I'd like to know what we currently have, if you could get that for me.
Absolutely. I know that's part of tomorrow's testimony. I don't have here with me.
And how many of these do you consider like permanent? I mean, some of these kids are in foster care till they age out.
Tanya will talk about that, but we don't consider any of them permanent. I mean, we always hope there's a plan to reintegrate, adopt, permanent custodianship. But yeah, some of them that are older and not going that way are on an independent living plan where we try to prepare them for independent living. But all of them are working on a plan of permanency at all times.
And then on the percent of children in out-of-home placements, I'd like to know that number. You know, maybe that's the same number, I guess, but.
That is the same number, because foster care, all those children are in out-of-home placements. Okay. They're either with a relative or a family foster home or in a institutional placement.
Okay, so it does count with family members.
Yes, with relatives and kin. That's out-of-home placement. The child's placed in the secretary's custody, and we place them with a family member.
I'd like to know the breakdown on that also. How many
Absolutely.
are in with family, whatever. And then
We have that.
the ACLU lawsuit, can you just give me just a snippet of what that, because, you know, I've had people in the past, I get calls all the time where somebody's had a child taken away and it's, you know, prove that you're not guilty. You know, it's never, you're not guilty until proven guilty. It's, you're guilty now, prove that you're not.
Yeah. The lawsuit, the McIntyre case, involved Kansas Appleseed. It was basically around child safety. One was there were a lot of moves, so the child didn't have stable placements. So part of that settlement was to limit the amount of moves. It involved making sure that the kids that were in custody had the services they need, like mental health services and things like that. That will be included also in tomorrow's foster care presentation in a lot more detail by Deputy Secretary Keys, who administers the foster care program.
Thank you. And how many homes does the state currently have? I mean, you know, it's Christmas, and I just think about these kids that have, you know, nowhere to go, and they're, you know, it's just sad to me. And I'm guessing that you don't have 6,850.
I'll have to get you the number of those homes, and like you said, we'll break them out by relative homes. How many are licensed family homes? How many are YRC placements, youth residential center placements, things like that.
Thank you. Them are good numbers, because that's my concern.
Sure.
We don't have a home for every child.
Sure.
That's an issue. So thank you.
Yes.
All right, any further questions for Dan? All right, see none? Thank you.
Thank you.
The next individual that I have is actually going to be virtual, and that's Scott Schultz, the Executive Director for the Kansas Sentencing Commission. Scott?
Good afternoon, Mr. Chairman, members of the committee. I appreciate the opportunity of being here today to talk with you. I am keenly aware that I am the only thing standing between you and being finished for the afternoon, so I will attempt to be as articulate as I possibly can. I am going to be providing the public safety agency perspective, I guess, to some extent. And again, I would like to apologize for my absence. My wife is having hip replacement surgery here in just a couple days, and we wanted to kind of be health safety as we possibly could. So I appreciate the opportunity to still present, but unfortunately not in person. Unlike some of the other agencies that you've heard this afternoon, we do not, the Sentencing Commission does not have any licensing authority, and we are not fee funded and receive about around 99% or so of our funding or appropriations from SGF. We have some federal grants that we get from time to time, but otherwise it's almost fully SGF. So that just kind of puts things in perspective for you. Just as kind of an overall thing, and I think hopefully this will be helpful for you. We have been doing performance-based budgeting for quite some time. The Division of the Budget obviously has been encouraging that for quite some time. And I think it's very helpful from a executive director standpoint when we submit our budget to the Division of the Budget that they do give us very constructive feedback. And sometimes that is, or most of the time that's good, because you don't have, you know, sometimes you look at these things quite a bit from your side of the angle, but then you have somebody that doesn't work in this all the time and doesn't know as much of the niche. They give some pretty good feedback as far as what they would like to see from the agency, and so that's very helpful in that respect. And we've actually adopted some of those recommendations as a result of that. So as you are aware, the Sentencing Commission is a small agency. much like several of these others that have testified today. We also have only 2 programs in operations in Senate Bill 123, which is a substance abuse treatment program that we administer. I'm going to talk just briefly about each, some outcomes in one of those in each of the programs, just to kind of give you a flavor of how we do things. So in essence, we're looking at 2 programs, and then we are mainly within the operations. For example, we do look at collecting all of the felony information that occurs when sentences happen all over the state. We get all of that data and place it in the database, and then we have that available for many different things to utilize. So, for example, any sentencing data that actually occurs, even criminal history, we're able to utilize that for a number of things, such as the first item that I'd like to kind of share with you, and that is the prison population projections that most of you are familiar with. We are statutorily required to do that on a annual basis. The KDOC cuts that data at the end of the fiscal year, and then we have 6 weeks to actually turn that data around in the form of a 10-year projection model. And so what that actually involves then is to make projections or estimates of the prison population for the next year, as well as the next 9 after that. And so what you have is in front of you. I think there was an extra handout that was done, and I will share that right now with you on the screen as well. But we closely track, and this is part of the budgeting situation, that we closely track about what our projections are versus what the actuals are, and you know, this is kind of like the consensus revenue estimates for the criminal justice system. My office acts as the State Statistical Analysis Center for Criminal Justice, and we get data from not only that which we collect, but also DOC, and KBI also provides data for us to utilize. So what you see here is kind of an extrapolation of the #1 outcome measure to give you a better idea, a 10-year look as to again, the role of technology and how it plays as far as our agency is concerned. We have a computer model that we put all of the information from our database in. We make assumptions as a result of several meetings with stakeholders, and then we do projections on an annual basis. And so this particular table shows you specifically that the model is the projected prison population, which as of a couple of years ago, we had about 10,000 total between male and females, to see how that prison population has increased since 2012. More importantly, for this particular context, as how closely we are able to project those populations. And the second table on the back side just kind of gives you the percent error that we actually look at. Normally in a, even an election context for that matter, a 5% on either side error rate is acceptable. I make my research folks, we get that our goal is 2%. And why is that important? And as you can see on the right-hand column, that percent error, with the exception of 2020 when things went pretty wild and it's at the beginning of COVID. It's important because we give this information back to DOC, we give it back to the legislature and the governor's office as a way to show potential increases then in prison population going forward. The decisions then can be made quite a few years out as to whether or not we need to spend $250 million to build a new facility to house more offenders. So it plays a very important role. This is one of the things that my office, one of the more important things to be able to provide value in doing this. And again, technology plays a good role in the computer model that we have had for almost 25 years now that our previous director of research actually built and is serving us very well today. So that is a one of the things that I at least wanted to share with you that that we track. We do that on a monthly basis, so then we can determine whether or not things have are tracking well. What I can tell you as of right now, certainly is that the prison population since COVID, normally in my office, we do a lot of trying to maintain, or as I tell people, we're the gatekeepers of the sentencing guidelines, and our 17-member board works to make sure that is monitor the guidelines, make sure they're functioning the way that the legislature wants them to, and then provide then any reform as things evolve and as the years go by. And so unfortunately or fortunately, COVID-19 has actually caused a significant decrease in the prison population. And so as of end of November, we were sitting at 81% capacity. And that was, if you take, or I'm sorry, 80%. 81% for the males and then 6% for the females. So that has provided an opportunity, thankfully, for Secretary Zamuda to certainly, as far as giving him a little bit more breathing room within the facilities. Unfortunately, they've had to take about 12 facilities off the line so that due to staffing issues. And so that has, thankfully the numbers are down, or that staffing issue would even be worse than, and I think he probably talked with you about that earlier today. So that provides an important part. Us collecting the data provides that, as well as all of the bed space impacts that you get every single legislative session. And obviously we're tooling up for that next for January. The second item is the Senate Bill 123 program. That is the substance abuse treatment program that I mentioned before. It is a little over $6 million that we administer. We pay over 140 treatment providers that are certified with the program for about $500,000 a month for various treatments, from inpatient all the way down to family outpatient treatment, relapse, and those type of things. So we almost act as a small insurance company in paying those type of things. Interestingly enough, again, part of our evolution in that particular program is to make sure that we are paying providers so that they can actually make a living, and many are mom and pop operations, to be able to cash flow their businesses to try and keep up with at least the block grant. And so as a result of our data that we have, we're able to most recently, here in the last couple months, approve a increase in payment to those providers for those different modalities, which has been a long time coming. So part of the way that we were able to do that was we started using a third-party vendor that has given us a lot of information that we were unable to do because we were pushing paper and doing a lot of things that required processing of paper rather than utilizing electronic transactions. We are now, we went from processing those invoices that we received from a 30-day time period to essentially every Tuesday they get processed. And so for folks that run small businesses that are clinical providers, that makes a whole lot of difference to them because they can pay their employees and keep them afloat. So all of those things are important to us. I guess, again, I keep hitting on this technology situation. I think, and my recommendation certainly would be that with some revenue surpluses that this body is seeing, that this would be a fantastic opportunity to invest in technology infrastructure. If we've really learned anything in the past year and a half or so, or almost 2 years, it would be, and certainly from our agency perspective, is that technology can help us in automating a lot of these processes and making things more efficient. So with that, I think that other than that, we are looking at different things at this point. We have a new study that, as a result of some of the data that we looked at, our research suggests that the duration of treatment within substance abuse treatment is certainly integral to positive outcomes. The duration and predictive models of recidivism have not been studied before in the 123 program. And as a result of that, we are going to be partnering with the Florida Institute of Technology to do a recidivism study and look for potential better ways of, as far as dosage and that type of thing, that hopefully will not only be helpful for this program, but perhaps for other substance abuse providers in the state. We are looking forward to that, probably about a year and a half away. But at the end of the day, again, the performance-based budgeting is something that certainly that our agency has been doing for quite some time, and it is very helpful that we can actually then see what's working and see what's not. So with that, I'll be happy to end your misery and stand for questions at this time.
All right, thank you, Scott. Committee, any questions for Scott? Senator Billinger.
Thank you, Mr. Chairman, and thank you, Scott, for the report. So what do you attribute the big drop to? Again, I know you said COVID, but is there anything else?
Well, it's certainly, we do not have any evidence at this point that it's because people are committing less crime. I will say that. But keep in mind that the courts have been closed for quite some time. Some of the things we are tracking admissions, and so what you're seeing on the handout that I gave to you is admissions to DOC, to prison. And some of those things up until recently, trying to get jury trials through the district courts have been a challenge. And in doing that, a lot of the higher, more severe, more violent, higher severity level crimes, a lot of those folks are still sitting in jails throughout the state. And so that's attributed some of the, and one of the things that I have cautioned even legislators at our the Joint Committee of Corrections and Juvenile Justice was, we're going to see that coming. There are a lot of those jury trial backlogs are going to be moving their way through. And that's just not in the large jurisdictions either. There's smaller jurisdictions are experiencing that backlog as well, and are trying to get those pushed through. So that would be some of that. I think there's been some negotiations and things like that, but that's certainly a factor that we have to consider.
Well, my second question, you touched on it. How many more folks are in local jails? I mean, that population's got to be pretty high.
I'm not able, Senator Billinger, to answer that. That may be an Ed Klump question, but certainly there's, from a standpoint of individuals that have not been, they're just waiting on their trial, and they'll receive all that jail credit that will be attributed to that. But keep in mind that most of the folks that go into prison now, they average about 2 years that they spend in prison. These folks that are waiting right now are murder cases and things like that. So you're talking at least minimum, mandatory 25 years. So there'll be a stacking effect that goes along with that.
Thank you.
Committee, any further questions for Scott? Senator Hawk.
Thank you, Mr. Chairman. Scott, on your substance abuse treatment program performance, in the history, you're talking about Senate Bill 123. Are all of the convicted offenders under the supervision of community corrections?
Senator Hawk, they are. The statute requires that they be supervised. What I will tell you is in addition to this, one of the things that we realized that the legislature passed House Bill 2026, which allowed for divertees to actually receive substance abuse treatment. In that context, both community corrections and court services folks will be doing supervision with that particular program, and we'll actually be administering that similarly to the Senate Bill 123 program. But to your specific question, community corrections in a post-conviction SB 123 context are the only ones that supervise them.
And is all of the budget amount, roughly that $6 million, does that strictly go to that network of 140 certified abuse treatment providers, or does some of that money go to community corrections to help fund the supervision?
To community corrections, no. We do have some administrative costs, such as the vendor Beacon Health Options that we use. There is a monthly fee that we pay to them, and then I have our director of Senate Bill 123, and then another staff member that is their salaries and wages are actually taken out of that. I'm sorry.
The bulk of it actually goes to the providers?
Yes, absolutely.
Good. Okay, thank you. I appreciate that. Thank you, Mr. Chairman.
Any other further questions for Scott? All right, seeing none, thank you for being here, Scott.
You're welcome. Thank you.
Now, we do have available for questions the Director of Budget, who's sitting in the back row in the corner. If any of you have any questions for Director Profit? Not seeing any. All right. Thank you. All right. Now, this was actually a suggestion. The next item on the agenda, which was kind of late notice, as I mentioned this morning when we started the meeting, but it was actually something that was brought up by Senator Hawk. And I felt that it was prudent that we go ahead and have an update. Actually, as I mentioned this morning, it's something that affected my home county and areas that I represent. Not only has this area been affected by the horrendous wind that we had on Wednesday, but they had devastating fires that burned the land, livestock, homes. About 15 homes have been burned down with those families displaced. Right now, we don't have an accurate count on how many livestock or how many cows were lost. There's been some estimations, but I don't want to say those numbers for fear that they might be an exaggeration. But the other thing to consider is this particular area of the state not only is suffering from the wildfires that occurred in the middle part of last week, but in May they also suffered flooding. And in fact, there was one individual that I was working with the city of Natoma and trying to get the post office back open, and his home was flooded in May, and then he lost his home after he had almost renovated it. He lost it in the fire last week. I had the ability on Friday to tour northern Russell County around the small town of Paradise. With Senator Moran. He was in with a tour, and then he also met with Senator Billinger and did a flyover in Ellis County to look at the damages that were caused by the wind and the fire in the four-county area. That approximately 400,000 acres were burned. Then Senator Bowers and I rode with the sheriff of Russell County, and actually, during the ride that we were taking with him, there were numerous fires that were still popping up because they just were not able to get everything out within those 2 days. I do know that today, because I spoke with him on the way up to Topeka this morning, Secretary Beam is visiting the area today, as is Insurance Commissioner Vicki Schmidt. She is out there to answer any questions that the individuals who have been hit hardest by this tragedy with any questions they might have in regards to their insurance claims. But it's going to be a long process. When we were talking to one of the ranchers that lost 200 head of cattle and also his home in the fire, and we were standing out in a pasture where you could see probably about 40 head of cattle who had perished in the fire. It's not exactly, this is never a good time, I will say that. But in the spring, when you have wildfires, the grass will come back up. In the winter, the grass is dormant, and it's just going to be bare ground until the spring, which could also have its own implications when we have, 6 inches of snow or rains or the continual wind like yesterday. We had 30-mile-per-hour winds back home. So we just wanted, I want to thank Senator Hawk for inquiring and asking for an update, because it's obviously been something that's been on my mind all weekend, actually ever since Wednesday, because I've been in constant contact with individuals who live there, with the state government, with the federal government, on trying to get some assistance for the individuals that were affected by those fires. So now we're going to kind of have an update on the wildfire and wind damage, and then we can also have some discussion on some ideas that we would discuss when we had our tour on Friday on what we can do, hopefully to prevent something like this from happening, but also assisting those that were affected the most by it. So actually, Major General Weishar, the Adjutant General of Kansas, I believe he's joining us virtually. If you would give us an update first.
Sure. Good afternoon, Mr. Chairman, members of the committee. You did a really good job of wrapping that up. So I don't know how much more detail I can give you, and I'm not sure where you want to start. So this event started was the 15th of December. So we really started our planning and looking at what was the potential on the 13th of December. So we gathered what we thought were going to be key players of this thing and the response actions at the State Emergency Operations Center on 13th and 14th of December. Always hoping for the best, but planning for the worst. So obviously the worst, or a magnitude of worse, actually happened on the 15th. So some of your state agencies that were involved with that planning was Department of Transportation, Kansas Forest Service, the Office of the State Fire Marshal, Kansas Division of Emergency Management, Kansas Weather Service, Kansas Department of Health and Environment, Kansas Corporation Commission, Kansas Highway Patrol, and the Adjutant General's Department as part of the National Guard. So all total, we've had 24 counties that have issued a local disaster or declared a local disaster, and that varied across the board, whether it's wind or fire or a combination of the two. So as this thing progressed and things started getting worse and we were able to start responding, or had to help the counties respond, they worked the mutual aid system very well. The counties, again, this is a great reminder in that counties are where the disaster starts and where it ends. So it can actually be the city as well. So all disasters start local and end local. We don't get involved at the state level until the capacity of the quantity is exceeded at the county level. Once they expand or exhaust all their resources, then that's when they reach out to the state for additional help. So once they reached out to the state, we being the State Emergency Operations Center, coordinated with the Department of Transportation, who coordinated with the FAA, and established a restricted airspace around the 4 counties where it was hardest hit. So as Representative Waymaster discussed, out there in his home area, Ellis, Osborne, Brooks, and Russell counties, we had a temporary flying restriction around that 4-county area. So we could suspend normal air activity, so we could put aerial firefighting response efforts out there. So all total, we had 5 Black Hawk helicopters from the National Guard that were assigned out there. They dropped over 85 buckets of water, a little over 600 gallons each time they do that. And we also had 2, it's called seats, single engine air tankers. Those are ag airplanes. So we're able to exercise 2 of those as well. And they dropped 26 loads. Over both of those were over a 2-day period. So the 16th and 17th is what those were in action. As you've seen in the news, and you all know, schools closed due to power outages and wind damage to some of those schools. So those schools are still closed through the holiday. So it worked out well for the kids that they got an extended holiday break. To go along with that, the report was 143,000 customers without electrical power. And I've got a breakdown for that if you want it, by Evergy, electric cooperatives, and municipalities. But all total, we had a report of 143,000 outages. Now, this morning at 9:30, we were down to about 900 across the state. We're still without power. So that's not great for those 900, but that's a lot of work on behalf of the electrical corporations, Evergy, and municipalities of getting power back to their customers. We're tracking 12 residents that were burned, 9 in Russell County, 2 in Lane County, and 1 in Wichita County, but those assessments are ongoing. So those numbers will change. We get daily updates from the counties as to what's happening out there. There were 132 residential structures that sustained wind damage across the state, and that too will change as assessments continue to come in. And I will go with Representative Waymaster's numbers there on the number of head of cattle that perished. Round numbers that I was reported, or that got reported to me today, was 700 head of cattle that need to be disposed of. So Kansas Department of Health and Environment provided permits for 5 locations for burying these dead carcasses. Another big event was Geary County was out of water. Their pumping station got flooded as they were trying to respond to firefighting. So they were without water. Kansas Department of Transportation was able to deliver potable bottled water from the state warehouse out to Junction City. So again, more state agencies working together to respond to a county's needs. Next steps for us for KDEM, Kansas Division of Emergency Management, is going to continue to be working with the counties and private nonprofits to figure out what kind of needs are out there, what is still broken, what still needs to be repaired. We have to get the damage assessment turned into FEMA within 30 days. We believe the state will exceed the minimum to meet a FEMA requirement. So round numbers, 4.8 million is what damages have to come to before we can turn it into FEMA. We believe that just the utilities alone are going to be between $5 and $7 million worth of loss. Again, we work through the county emergency managers and gather up all that data. One of the things that we always have to remind our counties, our citizens, is that FEMA doesn't pay for the things that you would think they want to pay for, that we want them to pay for. Anything that's insured, they don't pay for. Our cattle losses, fencing, houses, FEMA's not going to pay for that. So that's it's an insured or insurable asset, so they don't take care of that for us. So with that, that is a very large overview. I'm ready for any questions you may have, and I will try to answer them.
Senator Billinger.
Yes, thank you and the National Guard for all your help. I was told there was homes lost in Ellis County too.
I believe I'm aware of one that was possibly lost in Ellis County, but.
Yeah, I just, when I was there, they told me there was more than one, but he didn't mention Ellis, so I just thought I'd mention that there were some there.
Again, it's really how the county emergency managers report that to us. So it changes every day. So there's probably some loss in Ellis County as well.
Senator Hawk.
General Wilshers, thank you for being here. What does FEMA pay for if it doesn't pay for that which is insurable?
So it's a really hard answer. It changes every time we engage with FEMA, but they are more interested in public utilities and public access things. The thing that I've been using as the example is if we burned a bridge down, they will help us pay for a bridge. They will not help Evergy typically because they're a for-profit organization. So our Kansas Corporation Commission, they will help repair, or they help provide monies for their repair actions. But again, it changes by the event, and it changes by the dollar amount and number of people that have been affected. So we send in fact, we sent a training guide out as a reminder to all of our county emergency managers today on the process. And you'll find in that document, there is nothing really definitive because it's a big depends when you're working with FEMA.
Thank you. One of the questions I have, Mr. Chairman, I don't know who might answer that. My recollection is when we had the Starbucks fire in Anderson Creek, that the legislature allowed some sales tax exemptions for fencing. And I'm not sure at how that affects what FEMA does, if at all, and when the appropriate time might be for us as a legislature to consider that. And I would assume the sooner we could let landowners know they might have some help with that, the easier and quicker they could get fencing up. And I know some of that's going on now, but just a question for when that's appropriate with either staff or colleagues.
Well, I'll kind of answer part of that, and then I'll have the Adjutant General see if that's a qualifiable item with FEMA. We had a discussion about that Friday when we were there. And so Senator Bowers and I were discussing that legislation that was passed 4 years ago. She has actually reached out to one of the revisers to follow up on that. However, the legislation that we passed has expired. There was a finite time stamp on that piece of legislation. And so we are working at modifying that language to not have it have an expiration date, but instead have a trigger that, for example, if the governor issues a disaster declaration, then that it goes into effect. There was some other discussion that we had in regards of what that trigger could look like. But right now, it's not in place. And so we would have to have that introduced when the legislative session begins on January 10th. But that was one thing that we did, that she and I discussed as legislation that could assist with the individuals who need to reconstruct their fencing around their properties. Adjutant General, do you have any follow-up?
No, the only follow-up on that would be that I can give you a pretty solid affirmative. FEMA will not pay for fencing because it's private property. So as you were talking, I looked up a quick list of things that it's an eligible work for a disaster, and I'll just read this little list to you. Eligible work may include debris removal, emergency protective measures, roads and bridges, water control facilities, buildings and equipment, utilities, parks, rec facilities, and other facilities. So the buildings and equipment are public buildings and utilities, or buildings and equipment. So if a city, a township had a road grader burned up, that may be an eligible item that we could submit to FEMA. Again, no guarantee, because it all depends on who owns it, what's it used for, and what is the impact without that piece of equipment.
Any other questions for the Adjutant General? Senator Hawk.
And I didn't hear you say fencing, so I was looking back on what the damage was in the part. You said fencing would not qualify. Yeah, I wanted to hear fencing would qualify, but I did look at an article that I found that the Starbucks fire, there was $41 million worth of fencing damage. So I'm guessing we would have that or more in this incident.
All right, any other questions for the Adjutant General? All right, thank you, General Weishar, and if you'd stay on just in case somebody does have a question after I turn it over to Kelsey Olson with the Department of Agriculture. And she is the Deputy Secretary for the Department of Agriculture. Welcome to committee.
Good afternoon. I'm Kelsey Olson, and I can share a little bit about the Kansas Department of Agriculture. I mean, you've heard General Weishar's report, but as the ESF 11 partner, we have responded and tried to react and be supportive as possible as a state agency assisting with this. Just a couple things to highlight that we've done, or things, a few things I just want to point out, I guess. So we did immediately initiate our emergency response website and set up a consolidated location for resources, information. It's really an information gathering point. KDHE's information on burial and disposal is there, as well as the Farm Service Agency programs. There are 3 potential programs that producers might be eligible for based on livestock loss, equipment loss, emergency loans. There's some programming that may be fundable there. Fencing is still up for is a struggle, but there are some areas where it might meet some technical qualifications. We continue to try and support the local emergency managers. You heard it mentioned that all of the resources requests are supposed to flow through that county level, but we know that at this point in time, they likely are overwhelmed. So we've offered support however we can to help facilitate some of those and make them work within the state system as best as possible. We've continued to have conversations with our agriculture partners, such as K-State Research and Extension, Kansas Farm Bureau, Kansas Livestock Association. They're hearing directly from their producers and members and county contacts. And so gathering in information that we can share to pass up into the system is something that we've done, as well as share some of the existing resources that they've provided. General Weishauer touched on this, but I wanted to make sure that, I mean, inside of the 4-county region, there were additional fires across the state that that the Kansas Forest Service has assisted with or local individuals managed. But there are 9 and then maybe 10 or 11. There's one questionable on the Sheridan-Graham County line of different counties that were impacted. Trigo, Ellis, Russell, Wichita, Scott, Lane, Ness, Osborne, and Rooks. So the 4 counties and then drop down and head west, and there were fires that accounted for that. I had one report in Ness County that there was a spot that burnt that was 2 miles wide and 7 miles long. There were not any structures, home structures in that swath, but certainly cropland, pasture that were impacted. I think the only last 2 things that I would want to touch on and just point out is that due to the extreme winds across the state, while we have been talking about the fires, there were certainly additional losses. We've mentioned other structures, but in the agriculture world, there have been impacts of the specialty crop producers. So the hoop houses and high tunnels that are, basically plastic covered, small aluminum frame buildings. A lot of those were destroyed. Some of them had crops that were growing for spring harvest. So your early tomatoes and cucumbers and some of those vegetables, lettuce, were already planted and seeded in those hoop houses that our specialty crop producers have lost. And those impacts are across the state. If they had hoop houses, they've lost hoop houses pretty much and unanimously. And then in regards to the FEMA piece, I mean, we did learn during COVID at the beginning that FEMA, as General Weishauer pointed out, covers debris and disposal and cleanup of that piece. In the past, if there's been flooding, excessive flooding, that debris has sometimes been considered livestock, but they did not cover the euthanasia of the livestock that had to get put down that weren't able to go to market. And so that's been a continual conversation of the broadly, what are those things that they will cover and won't cover, and then where does the USDA emergency funding step in to help support? So those are, I don't know, some highlights to share. I'm happy to answer any questions.
Thank you, Kelsey. And one other discussion that we had on Friday, and then actually I shared this with Secretary Beam and also the governor, is access or outreach for mental health. Because you can only imagine, I mean, losing your home is terrible. Also losing a revenue stream in your business is terrible as well. I mean, it's just compounding on these individuals. And it may not be hitting them now, but a week or 2 weeks after the incident, they're going to need, and it was expressed that, some of the things that people are going through is just horrific. And the story that was shared with us on Friday was 2 25-year-old young men. I mean, it wasn't that they were older. They're fairly young. And so that if you could touch base on that, because I know like Secretary Beam and I discussed that, but one thing was what the Department of Agriculture's response is in regards to mental health assistance, and then also I would like to get in contact with High Plains Mental Health and Hayes as another post that individuals can go to if they need to talk to an individual or seek some mental health. So if you could touch on that too.
Certainly, and Chairman, I thank you for bringing that up because I'm embarrassed I didn't mention it, because that's been part of the conversation from the beginning, is the need for mental health support that the individuals impacted were going to need. And honestly, those assisting with the disposal or the euthanasia, the number of times a veterinarian or someone is called in and is broken down just by what they've seen is unreal. So the Kansas Department of Agriculture in 2019 launched a website, kansasagstress.org, and that is meant to be kind of a clearinghouse of a compilation of existing state resources that are available. In addition to, there was a farm and ranch assistance stress network grant dollars that expanded one of Iowa's hotline, farm ranch hotlines, to expand to coverage of Kansas. Those resources are all listed on the page. We have worked with K-State Research and Extension to develop some additional support materials. We've had conversations with the High Plains Mental Health Center in Hayes, as they're the most local community mental health provider. They need support, those impacted, and it's going to be a long-term impact and residual impacts there. And quite frankly, the number of providers in the state are understaffed in comparison to what our normal needs are, much less needs on top of a disaster. So that's where we've been working with Research and Extension. Sometimes it's as simple as having a conversation with a friend and a neighbor and just letting them know it's okay to not be okay and to be stressed. And just that conversation with loved ones can be as much as of a relief to some, and some others will need higher level of support. And so anything we do to continue to reinforce and to bolster up our mental health services in the state is much appreciated, because it will have lasting impacts.
All right, thank you. Senator Billinger.
Thank you, Mr. Chairman. I really don't have anything for you other than to tell you thank you for helping out our farmers and ranchers. It's an important time that we step up and try to help them all we can. But I just wanted to mention that Representative Wassinger and Rogers were also in Hayes with us. And one of the things we talked about when we get back in January is looking at maybe, the fence deal. We talked this just like you and Senator Bowers. But, not only did some of them lose their homes, their equipment, their outbuildings, their sheds, maybe we could come up with a program where at least they didn't have to pay sales tax on that, because we're talking a lot of money. You build a new home and you put a shop up, and if you lost some machinery, I mean, just taking most counties are around 9 to 10%. You just take that off a total cost for them would be helpful. So just one of the things that we discussed means we're talking maybe some options here. So thank you.
Well, and actually he was injured himself. He received burns, and that was the mayor of Paradise. And he lived in town, and actually his home burnt down. And nobody was at the house. So they lost all of the contents of the house, the home itself, and he lost his pickup, his bail bed pickup, and his wife's car, because they were all in the driveway. So yeah, I mean, there's a lot of discussion. One of the other things that got brought up when we were talking to the emergency manager of Russell and Ellsworth County, and actually he had brought this proposal up, and I need to have the revisers look into it. I think some other states have this precaution in place, where if you're going to be experiencing high winds, or if there is a high wind advisory, the power companies have to automatically shut off the power lines. That's where the fire started. was from the power lines. And if you know we're going to be having the potential of having 60 to 70, and in that case, in Russell County, we clocked winds at 100 miles an hour that day. Like the emergency manager said, he goes, I'm sorry if at 11 o'clock your soap opera is on and the power company turns off the electricity. It's a lot better than what we're living through right now. And so I don't know if that we have to do that through legislation or if it can be done by regulations. But then maybe that's something that we look into as well, especially if you're going to have extreme wind like that. So we can prevent that from happening, because it was caused by the slapping of the power lines together and sparking, and that's what started the fire.
Some of the western states do that.
Yeah. So, any other questions for the Adjutant General or for Kelsey? All right. Thank you for the update to both of you. I am constantly receiving updates of what's going on. As I mentioned, we were driving around with one of the individuals who lost 200 head of cattle and his home. So he and his wife were displaced, and we were actually driving around in Senator Bauer's car. She had me drive because I know the area better than she does. And he was in the front seat with me, and it was like it was an outlet where he could I've known this guy, this individual, pretty much my entire life. He played basketball against my uncle and my dad in high school. And so, I've known him my entire life. But just the anguish and I hate to say it, just like a sense of defeat, where you had this whole livelihood, and then in just a few hours, it's just completely wiped away. And like he told me, he said, I was, wanting to retire, and now I can't, because I got to build all this back up again. But I think it was good for him just to have that outlet, just to have somebody to talk to. And even though we were driving around the midst of, the devastation of everything, I think he needed just to get away from the headquarters of the Methodist Church in Paradise and just get out of there and talk to somebody. And that's why I think the mental health aspect of this is going to be key, because as you mentioned, Kelsey, this is going to be a long term. This is not going to be over within a few weeks or when the grass comes up in the spring. It's going to be a long-term situation. So I want to thank you for the update. I know it was short notice, both to the Department of Agriculture, especially you, Kelsey Olson, and then also to the Adjutant General for giving us an update. And thank you again, Senator Hawk, for suggesting that we have that update. Committee, is there anything else before we wrap up the events from today? I'm not seeing any. Amy or Jill, do you have anything? Okay. Tomorrow morning we'll be starting at 9 a.m. and I know that Senator Billinger is going to have a whole bunch of questions in regards to foster care because he had a lot today. So we're going to be starting at 9 a.m. So until then, we are adjourned.